In most of the cases, like I said, we have had asymptomatic transmission. So in those individuals, somewhere in that 2 to 14 days, they begin shedding the virus without any symptoms. So you wouldn't be able to tell if they were symptomatic or not. And so typically, I think the average has been 7 to 10 days if people are contagious. But we do know that they've been contagious because of asymptomatic spreading. It's generally about 24 hours before those first symptoms show up if they're going to get symptoms.
So you had said flu symptoms start 1 to 4 days after exposure, and COVID symptoms start 2 to 14 days after exposure. How does it spread? How does COVID-19 spread?
So COVID-19 is spread through airborne droplet transmission. So right now, as I'm talking in this room, I'm spraying airborne droplets. Those of you that aren't even speaking right now, just inhaling and exhaling normally, you are spraying airborne droplets. You can spread airborne droplets through singing, talking, coughing, sneezing, pretty much everything you're doing where air is coming in and out of your body. And so COVID-19 is spread through those droplets to others that are nearby.
Okay. And you said nearby. Can you explain that a bit further?
So in the public health world, we look at typically for airborne droplet spread diseases, you're looking at a 3 feet barrier. So it's your arm's length typically is what we look at. That's typically around 3 feet. For viruses such as this, where it's new and we are trying our best to protect as many people as possible, barrier gets extended to 6 feet, just to make sure that if I were to cough or to sneeze, that those particles couldn't float further than that 3 foot window. And so what I like, if you've ever pictured one of those games where people have a bubble suit on and you're banging into each other, that's what we were looking at. So you're looking at a 6 foot radius around a person that we were trying to use to keep those airborne particles from spreading person to person.
So these are, I'm sorry, can you tell if someone is contagious with COVID-19?
No, unfortunately, you can't just look at someone and know that they have COVID-19.
And why is that?
Well, for one, like I said, we have asymptomatic transmission. So, I'm feeling perfectly fine and still spreading the virus to others. Secondly, we have allergies in Kentucky, and a lot of the symptoms of COVID-19 mimic allergies. So, I don't know how many times in the correctional facility outbreaks I worked or long-term care where I thought it was allergies. I came into work anyway. I thought it was allergies, and it turned out to be COVID-19. The illnesses range from asymptomatic, mild, to very severe, and we've seen, people all along that continuum. So it would be very difficult to walk into an and say,
I'm sorry, the doorbell of letting somebody in the room bleeped you out a little bit.
Oh, sorry.
You said they're difficult to walk into, and that's it. Okay.
It's difficult to walk into an establishment and look around and say, this person has COVID, that person doesn't have COVID.
And you've given a great deal of information now about COVID-19. On what are you basing this on?
So a lot of the information that I've talked about is from CDC, from the Centers for Disease Control and Prevention. Also, our articles from the New England Journal of Medicine and from the National Institutes of Health.
Okay. Are those established medical journals, or what are those?
Yes, the New England Journal of Medicine and is a widely accepted and used journal publication, and the National Institutes of Health is an organization similar to CDC.
And in reading those, why did you read those journals?
Well, as an epidemiologist, it's our job to know if we're going to go out and do mitigation and investigation and talk to groups about strategies to prevent the spread of illness. It's our job to research and to understand the topic that we're looking at. And so during this entire pandemic, all of us epidemiologists spend a great deal of time researching the latest information on COVID-19 so that we could give the best guidance and assistance to the organizations we were serving.
Yeah, thank you. I don't know that we've discussed this yet, but I do want to return to it if we have. How long after infection are you contagious? As a person contagious?
Right. So typically, if I were to have COVID-19, today would be day 1, and typically I'm going to spread that virus for around 10 days. We do know that in some individuals that are immune compromised or that have very severe illness, that they can spread up to 20 days. But for typically most people, it's going to be 10 days that you're spreading the virus. We also understand that you may be able to test somebody on day 20 and still find viral particles on a swab, but those particles are not infectious. It really looks like the infectivity of the virus goes down dramatically after day 10.
And how can you tell whether something's infectious or not?
So if you're asking, like, are you asking about how, like, the scientists have determined that at CDC?
No, I'm asking essentially if COVID-19 is present in the particles, how can you tell whether those are infectious or not?
So there's been a lot of research that has been done by different groups of scientists, like at CDC and other states, where they've looked at on those swabs whether they swab someone at day 20, and if that they can use that to then reinfect lab rats and in laboratory settings. So CDC has put out several research articles that have determined that 10-day window.
Understood. And when you testify here about COVID-19, you said you've come about this knowledge through research into medical journals. Are there any other methods that you use to determine this information?
Besides that, just working with the team we have here, we have CDC experts at the DPH team and other laboratorians and epidemiologists and scientists here that we do information sharing. Some of the mitigation strategies, not necessarily the science, but the mitigation strategies, those are learned over years of practice of being an epidemiologist and how those mitigation strategies work.
Okay. And we'll get into the mitigation strategies here very soon. The journals that you mentioned, are those peer-reviewed journals?
Yes.
Okay. So let's see. So having, I guess, established sort of a basis of knowledge on COVID-19, you said that the response to COVID-19 began before March, but what measures have been undertaken in Kentucky to combat the spread of COVID-19?
So going back all the way to 2003, when I started as an epidemiologist, Kentucky had to develop pandemic influenza plans and other disease outbreak support plans. And so in those plans, when we looked at how we would combat a novel virus, whether it was a novel influenza virus or a novel other type of virus, we looked at different strategies that we would use to combat that, because we have no treatments, we have no vaccines, so how can we keep this from spreading? And so the biggest thing that we looked at is what we term non-pharmaceutical interventions. And so in that part of the plan, we talk about strategies such as face mask usage, hand washing, hand hygiene, surface cleaning, social distancing, those types of messages that we could put out to the community, because combating a virus where you have no known treatments and no known vaccines, we're trying to do the best we can to keep that from spreading in communities. And so those plans have been in place for decades. And so when this virus first popped up in China, we began to pull those plans out and look at, what of these strategies that are in all of these plans could we use to combat COVID until we could get treatments, until we could get vaccines.
And those non-pharmaceutical interventions you speak about, have they been used in prior novel virus outbreaks?
Yes. So in 2019, we had H1N1, which was a novel influenza virus. And so we used a lot of the same non-pharmaceutical interventions during that pandemic. Fortunately, we were able, because it was a flu virus, to develop a vaccine very quickly and deploy that very quickly. And so we didn't have to use the full cadre of non-pharmaceutical interventions like we did for COVID.
And what do you mean by the full cadre of non-pharmaceutical interventions?
So in 2009, we didn't do face masking, and we didn't really do any of the capacity restrictions that we deployed for COVID. We did do messages on hand hygiene, on surface cleaning, and on social distancing.
And if you could just remind me, what were the non-pharmaceutical interventions that were undertaken in this particular pandemic response?
Right. So we pushed social distancing, and for social distancing, we used 6 feet. We also did capacity limits to aid in the ability for establishments to do social distancing. We did messages on hand hygiene, on surface cleaning, and the use of face coverings.
And so you spoke about sort of social distancing. What's the purpose of social distancing?
So to get back to what I said just a minute ago with the bubble, if you're talking about a 6-foot bubble around each individual, that means if we're staying 6 feet apart, if I were to cough or sneeze or even just talk, my airborne droplet particles would have a really hard time getting to the person next to me. In all likelihood, they're probably going to go 3 or 4 feet and fall to the ground. And if there's no one between me and you in that 6-foot window, they're just going to fall to the ground and be gone. So the thought was that if we could keep people apart, far enough apart, it would be very difficult for those airborne particles to go person to person.
Gotcha. And so what you mentioned face coverings. How do face coverings help combat COVID-19?
Right. So for face coverings, the point of face coverings for the general public is, and even in medical settings, is to keep your germs to yourself. So if I have something over my mouth, it's going to be very difficult for my airborne particles to get through that cloth and go into the air. There is some minimal protection to the person wearing it from the airborne particles around them. But unless you're wearing a fit-tested N95 respirator, you're not getting a lot of benefit from not picking up other people's germs. It's mostly to keep your germs to yourself and keep them from entering the airspace.
So the purpose of wearing a face covering is not personal safety, but sort of public safety.
Correct. It's to keep the people around you from coming in contact with your germs.
Okay. And you mentioned hand hygiene. How does hand hygiene help combat COVID-19? So
hand hygiene is the number one public health measure that we use for all diseases to stop the spread. Early on in the pandemic, we weren't 100% sure how this disease was spreading. And so we did a lot of recommendations for surface cleaning and hand hygiene because we weren't sure if contaminated surfaces were leading to some of the transmission, if it wasn't just solely airborne. But as we've moved forward, we've been able to do better research and understand that there's very limited spread on surfaces and on hands. It's mostly airborne transmission. And so, but hand hygiene is always a good thing to promote, and it's something we always try to promote in all settings in public health.
Do bars and restaurants play a distinct role in the spread of COVID-19?
So we deployed all of these non-pharmaceutical interventions to long-term care facilities, to correctional facilities, to church schools, to any setting where people congregated. But restaurants and bars posed a particular challenge because the activity you're going to that place to do is going to cause you to spend a large amount of time without your mask on. You can't go to a restaurant and eat and drink masked. And so we realized that those places were particularly problematic because of that. In a long-term care facility setting, for instance, we can make all of the residents stay in their rooms. We can make everyone in the facility mask and keep those people safe. But in a restaurant, because of what you're there to do, you're going to have to remove that mask. And so we knew that would potentially create a public health hazard just by the nature of what you're there to do.
And
something we always try to promote.
As far as bars specifically, as opposed to restaurants, are there any specific implications of the bars on the effects of, on the spread of COVID-19?
So bars are also offer up a unique situation. Typically, in a restaurant area or just a standalone bar, the space is smaller. People will be unmasked potentially for longer periods of time, closer together. And what you're there to do at a bar generally is to consume alcohol. And we know that alcohol inhibits your thought process, just the nature of what it is. And so in a setting like that, you have people who would be participating in an activity that would be inhibiting their thought process and their thought for their safety. And so you could be creating additional safety hazards the more people consume beverages around a bar setting.
And so with that in mind, are there any measures specific to bars and restaurants that have been undertaken?
So we looked at doing social distancing and capacity limits and masking were kind of the areas we looked at with bars and restaurants. So the social distancing allowed for the capacity limits allowed for social distancing to happen easier. If you're looking at an establishment that can hold 100 people, if you cut that down to 25%, then those 25 people can space out better in the facility. You can get that 6 foot of distance. So that was why there were capacity limits. And we did this for dining in long-term care facilities and corrections. It wasn't any place that we knew that people could congregate to consume food and beverages. We tried to limit capacity and we tried to socially distance those spaces.
Is limiting capacity related solely to assisting in social distancing? Are there any other, what other implications come from, or what other benefits may come, if any?
Yeah, it was mainly just to make it so that social distancing was easier to accomplish.
Okay.
We felt like if we set those capacities, it would make it easier for the restaurants to understand how many people they could fit in a space and still maintain that 6 foot of distance.
As far as indoor spaces, are there any greater concerns or lesser concerns between indoor and outdoor spaces?
Right. So I'm not an industrial hygienist. I'm an epidemiologist. So I can't speak to air ventilation, air exchanges. I don't have any expertise on that. But what I do know is that in an indoor space where people are unmasked, you're going to have airborne droplets that are in the airspace that is there. And so the more people that are unmasked, it stands to reason the more air droplets that are being put into the airspace that people are located in. And CDC has put out a lot of research on outdoor activities. And we know too, just from my background in biology, if you're trying to do virology in a lab conditions are perfect. And when you start to add UV light and air flow and temperature changes, those viruses break down really quickly. And so we know that being outdoors there's a lot of different things that can cause the virus to degrade very quickly out there, as opposed to an indoor space.
So I think are there any other, are there any other measures that have been undertaken that, to combat COVID-19?
Yeah, those were the main ones. As everyone on this call is aware, since around mid-December, we had a vaccine and we were able to deploy that vaccine. So that's completely changed the game since December, as far as efforts that we can do to combat the virus. But up until mid-December, these were the only interventions that we to try to stop the spread.
Okay. So when one of these safety measures is put into place, how long does it take to show effects on the incidents, if any?
Right. So one thing that's important to note is that there's really no way to break apart and look at, did social distancing versus masking make a bigger difference? Because of the severity of this illness, we deployed them all at the same time. And so when we look at them, we're looking at them all together, not as individual interventions. And so typically what we look at is, because of that 2-week incubation period, you want to look at interventions needing to last at least 2 weeks in order to change, because you need all of those people that were exposed the 2 weeks prior to those measures taking place to either become ill or not and finish their quarantine, and then you would see changes in the numbers of people that were being infected.
Have we seen any measurable effects from these interventions?
Yes. And so, when we were sitting back in September, we were seeing cases rise dramatically, in some cases doubling each week. And so we were very concerned at this upward trajectory of the cases. And so, we did see a dip after these interventions were done in November. And then as soon as they sort of lifted and people went back about their business of holiday gatherings and eating and drinking and being with people outside of their family bubbles, we saw a dramatic increase again in cases. But then we've seen a dramatic drop off since then because of vaccine.
And there's, I have a chart that I'd like to show you, if I could. Let me go ahead and share the screen. Let's see if we can. There we go. Can you see that?
Yes.
Okay. And you provided that. You provided me with this. What can you explain this chart to me?
So this is an incident rate chart, and so what incident rate is in epidemiology is the number of cases over 100,000 of population. So it's a way that we can even out the numbers and be able to compare, for instance, counties to counties. And so this is for the entire state, and you can see there around September the 1st, we start to see this marked increase in cases. And then you'll notice a little dip right there, right after, and then it pops back up. That little dip is actually from the Thanksgiving holiday. We just didn't have a lot of people that got tested and a lot of people that got results. And so that's why it dips and then pops up. But then you can see that second orange pop there, that is where those interventions were taking place. And so that dramatic decline after that is attributed to the interventions that were going on. And then the spike after that is approximately 2 weeks after those orders were lifted and people went to holiday gatherings and went to bars and restaurants and other establishments after that. And then, like I mentioned, that dramatic decline after that is when vaccine became readily available in Kentucky. And so our numbers have dropped very dramatically since then.
Okay, so sorry, let me go back a little bit. So the Executive Order 2020-968 was issued on November 18th. and that's the one that shut down indoor dining. At that time, how many people were known to have been infected in Kentucky?
So around 145,000 people had been infected from March until that point in time in Kentucky.
Okay. And do you know how many of those people had died from COVID-19?
Approximately 1,700.
Okay. Do you know how many people, and I'm sorry, it appears that around that time, is it safe to say that the number of cases were increasing?
Yes.
Okay. And what concerns did that create?
Our main concern really from the beginning was hospital capacity. We were very concerned at this point in time with what this was doing to the hospital capacity in Kentucky. And so it's important to understand when we talk about hospital capacity, COVID was happening on top of all of the regular stuff that happens in hospitals. And so we were seeing hospitals that were running out of ICU space, that were potentially cutting it close on having enough ventilators. And so really the ramifications of that is that if there's a 10-car pileup on I-75 today, and all of the ICU beds are taken in the Lexington metro area, what happens to those people? And the medical providers would have to make tough decisions on, who's going to get these limited resources. And especially if they're already all taken with COVID patients, then what? So from the beginning, we were trying to protect the citizens of the Commonwealth, but we were also trying to keep our hospitals from having issues where they had to potentially ration care or make really tough decisions like they did in other states.
And you provide another chart on that, if you could. I'd like to provide that. Can you explain this chart?
So the blue line that you were looking at, and this is Region 5, so this is the Lexington metro area. This is not the entire state of Kentucky. And for those of you that are familiar, the Lexington metro area has several large hospital systems that would be in that region. So the blue line is inpatient admissions, and these are just COVID cases. So you can see that we were seeing this uptick in those cases as well in October. We were also seeing spikes in ICU usage. ICU and inpatient go together a lot of times because COVID patients will come in as inpatient, they decline, they go to ICU, they improve, they go back to the regular floor, all the while remaining an inpatient. And then you can also see that ventilator usage, it was having some spikes there in October, but we started to see some even bigger spikes in December, after the orders were lifted. And ventilator goes along with ICU. So a lot of times people, when they decline and go to the ICU, they decline further and are on a ventilator. And a lot of our patients, spent 6, 8, 10 weeks on ventilators. And so that's why that line stays kind of flat, is because a lot of times they're on that ventilator for a very long period of time.
Is it a guarantee that if you get infected with COVID-19 that you will be inpatient?
No. We've had a lot of patients, especially in my work with long-term care facilities, we had a lot of patients that were asymptomatic and were very mildly ill. But we did have, some care facilities where they sent out half of their patients to the hospital for care. COVID is one of those illnesses, like I said, it ranges from asymptomatic to very severe illness and death. And so it's very unpredictable what will happen. I mean, just looking at the cases in our master line list, we have individuals that are 99, got it, maybe had a sniffle, they were fine, and we had individuals that were in their 40s that died. So it's very, very difficult to kind of answer that question about, how what someone's outcome will be.
Sorry, I'm very close to a very loud street, so sometimes I need to mute to make sure that I'm not drowning out and deafening everyone with the noises that pass by my house. This blue line does not necessarily, if you're not necessarily going to be inpatient, this line does not necessarily represent the entirety of the I guess the incidence of COVID-19 in Lexington or Region 5.
Right, but you can see that those match as far as the upswinging cases, and you can see.
I'm sorry, you cut out again. Those match.
It matches the incidence curve that we were looking at earlier. This uptick, those upswings match very closely, and you can see, in the hospitalization chart, there was a spike there right around the time that the order was put into place. A really large spike of inpatient cases in Lexington, and so when you're looking at the reason that graph pumps and bumps there is because those individuals that were exposed right as the order was put in place were becoming ill in those following 2 weeks and being hospitalized.
Right. So, looking at the capacity chart, is there any other explanation for this decrease or this decline that this chart shows?
Right. So I've explained the first little bump down and bump up there. And we saw, it was Thanksgiving, no one went to get tested until the next week. And so it created an artificial little bump there. But the decline after that matches up with, the 2 weeks after those orders were put into effect. We just were not seeing as many cases as we had been seeing previously. And if you look, the next big spike is the after Christmas spike. So after the orders were lifted, about 2 weeks, that's the spike that we got because everyone went back out to resume their holiday celebrations.
Gotcha. So I'd like to move to admit these two charts as complainants exhibit or departments exhibit 1.
Mr. Reese, any objection?
You're muted.
Muted.
Sorry, there we go. Subject to my same objection about the expertise in all of this testimony in general. I do make that objection, and I don't think she said that she prepared this data.
That was not covered. I will agree with that.
I did say that she provided it to me. I can ask her whether she prepared it. Ms. Bolin, did you prepare these charts?
I did not prepare the charts.
Who did prepare these charts?
Our main data epidemiologist, Ben Scott.
Okay.
This goes to the expert issue also. Every bit of her testimony has largely been hearsay. If she's an expert, she gets to, rely on hearsay. If she's not, all of her testimony has to be stricken. So I have the same standing objection to this that I've had all morning.
I will fold it in with the consideration that's been previously held under submission. But if it's admitted, I will mark all the charts that's been used so far as Exhibit 1 from the department.
Thank you. So if restaurants and bars had continued to operate normally instead of this order going into place with COVID-19 no COVID-19 restrictions, how do you believe Kentucky would have been impacted?
I'm going to rate. I know I've had a standing objection. I'm going to make a specific objection to this particular question. It calls for speculation. It calls for. She's not testified that she's done any studies about the effectiveness herself of these interventions. We are in rank speculation here that I don't even think an expert, because there's been no testimony about methodology or anything else that would give rise to being substance for this. There are all kinds of of problems with this, even under a 703 expert in terms of reliability and everything else. So I make the objection now on this question and its answer.
Well,
I'm going to, Mr. Newton, do you have a response to that?
I want to ask a different question, but related.
I did this specific objection occurred roughly at 9:59, so I will make sure to distinguish that. But I believe it kind of goes into the original objection, Mr. Weist. But I'll let Mr. Newton move forward since he's.
So just for the record, yes, ma'am. Just for the record, my original objection was to her qualifications and capacity to testify. We're now into her testifying about things that really go to Daubert, and there is no way that this is reliable under a Daubert standard, what he's calling for. So I'm raising the objection. I mean, it's simply rank speculation.
I think this will need to be covered then in a more formal written format, which you're free to do in the post-hearing. But either way, for time-wise in the record, I know that about 10 o'clock, this is when the objection was made. So, Mr. Newton.
Thank you, Ms. Stevens. In states, in surrounding states that did not put these in place, did you find similar dips?
Yes.
Around these times?
And that data is widely available on CDC's website. And if you go to other states' websites, CDC actually produces a chart every day on their website that shows the incident rates in other states. And so you can look at states where these interventions were not done and see that their cases continue to climb while Kentucky's dropped and kind of flattened off a little bit.
Well, let's see. So if a restaurant or bar were to have ignored the mask mandate for the patrons, do you believe that would have created a hazardous condition for the patrons?
Yes. I believe that if we're going back to November, we were seeing such dramatic spread across the Commonwealth that establishments that were allowing patrons to gather closer than 6 feet, ignoring mask mandates, ignoring capacity limits, were creating hazardous environments for their patrons and for their staff. As I spoke before, we know that masks offer minimal to no protection from the air around people to the people that are breathing it in. And so, they were creating hazardous environments for staff that were in that environment for 8+ hours.
Okay. And I think you covered my next question, which was ignoring indoor capacity restrictions. You said, I believe, that you believed that that would create a hazardous condition if they ignored them. If a restaurant or bar had ignored the temporary prohibition on indoor dining from November 20th to December 13th, 2020, do you believe they would have created a hazardous condition for their patrons or employees?
Same
Yes.
objection.
You say yes?
Yes.
Okay. Can you think of any legitimate reasons why a restaurant or bar would ignore these measures?
Objection.
It'll be the same treatment for these objections, but you can move forward, Mr. Newton.
Thank you.
Yeah, Your Honor, I just want to be clear. Now we're speculating about what bar owners may have been thinking or what their justifications were. I mean, we're way outside epidemiology. Now she's a mind reader. And I mean, this is absolutely impermissible testimony.
The law states that if a hazardous or physically offensive condition is created with no legitimate purpose, then it is a disorderly premises. That is not going to the intent of the party involved, but rather a more factual designation of what a legitimate reason is.
You've got an epidemiologist testifying about what the reason a bar owner could have or not have for something.
I will sustain that part of just if we could limit it to Ms. Boland's knowledge and what she would normally prepare or encounter in the course of her duties, then I think we'll be on the right track. You may proceed, Mr. Newton.
Thank you. And do you believe that a restaurant or bar that ignore these measures created a threat to public health, safety, or welfare?
I do.
And why is that?
Like I've stated previously, we were seeing cases increase dramatically. And so from an epidemiology standpoint, we know that the disease was spreading rapidly person to person through not only Fayette County, but all of the counties in Kentucky. And so with the incidence rate being that high at that time, having establishments that were allowing people to gather without masks, without social distancing, was creating a definite public health hazard.
Well, thank you. I have no further questions.
I have extensive cross-examination.
Well, let me just check in. We're about an hour in. Ms. Boland, do you need any kind of water break or anything like that?
Can I have 5, please?
Yeah, that would be fine. I usually take breaks about an hour or so. So if we could just come back at 10:10, it's now 10:05. We'll resume the cross-examination with Mr. Wheat.
Thank you.
Thank you.
Thank you.
I'm going to go off the record then. The time is 10:05 a.m.
on record. Ms. Domenico?
Before we get back on the record,
I'm sorry?
I'm sorry, I'm trying to gather my thoughts here. Ms. Stevens, I had not spotlighted the witness. Do you prefer that I do that?
I believe my recording settings are where they are spotlighted. So the will be, I believe, the format that you're supposed to have. So that's only the person speaking that will be highlighted in the recording.
Okay, because the video frames keep bouncing around and mine doesn't show that it's spotlighted. So
I believe you can if you want to. I think it's already on that setting. But if you feel it needs to be switched, that's fine.
I just spotlighted on my end. Did it change anybody's view?
Yeah, it says it notifies that it's on.
Okay.
All right. If you're ready, we'll get started again, and Mr. Reese can move forward.
Stand by. I'm on the record. The time is 10:14 a.m. I can't hear.
Are you ready? I'm sorry. I was waiting to tell me you were ready. Sorry.
Yes.
Good morning, Ms. Boland. My name is Chris Wiest. I represent Dean's Diner, LLC, doing business as Brewed in this matter. Let me start with just a couple background questions. Do you believe that the governor of Kentucky took effective measures to prevent the spread of COVID-19?
Yes.
Do you believe that at any time the governor failed to take necessary action to protect the public? In other words, was something he should have done that he didn't?
I object to this. It's not relevant.
Counselor, for the last 45 minutes, we've heard testimony about people being endangered by not following the governor's orders. And I think I'm allowed to test the efficacy of the orders as well as that contention. We're right in the heart of cross-examination.
I'm going to allow the question, although I think it could be reframed better as far as, Ms. Boland's knowledge and what she's encountered in the course of her duties.
Sure. Ms. Boland, to your experience, has the governor failed to enact any public health measure that you think he should have done to protect the public from COVID-19?
No.
Let me ask, do you have a master's in public health?
I have a master's in public administration, community health.
Okay. So the answer to that question, do you have a master's in public health, is no, correct?
Yeah. Correct.
It's true, you also do not have a medical doctorate degree, correct?
Correct.
It would be true that you're not licensed to practice medicine in the Commonwealth.
Correct.
It's true that you're not an industrial hygienist, correct?
Correct.
And obviously that would mean that you're also not a certified industrial hygienist, correct?
Correct.
And I think part of your testimony on direct was that you recognized that industrial hygiene was the science and art devoted to the anticipation, recognition, evaluation, and control of environmental factors such as including diseases, right?
I guess.
Okay. You personally have not conducted or participated in, or researched, well, let me back up. You personally have not conducted or participated in any studies on COVID-19, correct?
Correct.
You personally have not conducted any peer-reviewed research on COVID-19 yourself, correct?
Correct.
You yourself have not published in the area of COVID-19, right? You've not published or engaged in any publications?
I have a publication that's being submitted in the long-term care facility research. It's being submitted to a journal, but it's still in review.
It's still in review. It's not been peer-reviewed at present, correct?
Correct.
Okay. You personally treated any COVID-19 patients?
No, because I'm not a medical professional.
Okay. Have you personally observed the treatment of any COVID-19 patients?
No.
You use the term "we saw patients" throughout your direct. Would it be fair to say that that was simply something that was reported to the Department of Public Health from people that were engaged in frontline treatment?
Yes.
In terms of your testimony here today, would it be fair to say that really all of it was based on hearsay, information that other people were passing on to you in your capacity of as a public health department employee?
No.
Okay. What did you personally observe in terms of COVID-19?
I personally worked with and talked to several long-term care facilities, correctional facilities, those serving those places where individuals were having outbreaks of COVID-19. I talked directly to those administrators and nursing leads.
Or did you personally go into those facilities?
No.
Okay. So again, that was just information that those facilities were passing on to you, right?
Yes.
Your testimony on direct was that you believe that COVID-19 was spread primarily, I think actually you said it was through droplets that were being emitted when people talk or sing, etc. Is that fair?
Correct.
Are you aware that recent studies have suggested that it's actually aerosols and not droplets?
Yes, but we were talking about our knowledge in November.
Okay. So you understand the science behind public health measures relies in part on understanding how the disease spreads, correct?
Correct.
And if in fact we now know that it was aerosols rather than droplets, the public health measures that would be appropriate for aerosols versus droplets would be different, correct?
Correct.
So as we sit here today, let's talk about a couple things. The 6 foot, you talked about needing social distancing and the 6 foot barrier as being one of the public health responses throughout this pandemic, correct?
Correct.
If in fact it's aerosols that are driving the COVID-19 spread, those stay in the air, right?
Yes.
And obviously social distancing may not be enough to protect against those, right?
Correct.
Let me ask, as an epidemiologist, are you aware of any certified industrial hygienists that have rendered opinions that in fact the appropriate and better course to keep people safe would have been ventilation and appropriate HVAC equipment to destroy the virus?
I'm not aware of those articles.
Okay. And you yourself, I think we just talked about, you're not a CIH, so you can't speak to those issues. Fair?
Fair.
If an individual restaurant had adequate ventilation and an HVAC system was destroying the virus, there would not be a risk from that facility, would there?
I'm not an industrial hygienist, so I don't know.
You don't know. Okay. Do you have any evidence as you sit here today that the respondent any 6-foot distancing requirements?
I was not involved in any of the investigation at that facility, so I'm just here to talk about the epidemiology of the disease.
Okay. You mentioned that you reviewed CDC materials and New England Journal articles in rendering your opinions here today. Fair?
Correct.
What specific CDC materials did you review?
So I looked at MMWR articles, which is the mortality journal articles that they put out, the Morbidity and Mortality Weekly articles. I also reviewed other articles. When you would look at the MMWRs, they give other peer-reviewed journal articles that they cite in those articles. So
Which
I reviewed some
articles.
I'm sorry, I would have to go in the list.
As you sit here today, you can't cite to me any specific article. Fair?
No.
Okay. You indicated the New England Journal articles you reviewed as the basis of certain of your opinions today as well. Fair?
Correct.
Which specific New England Journal articles were you relying on?
There was one that was specific to looking at transmission of COVID-19 in facilities.
And what was the title and author of that study?
I don't have that available.
You can't cite that for me either. Okay. You talked about prior experience as partially driving the public health response. When, in your experience, have we ever previously shut down indoor dining throughout the state?
Not in my experience have we shut it down through the state. I've been personally responsible for shutting it down in different investigations I've been a part of.
And that's in the event, for instance, that there's a bad salmonella outbreak, you got to shut down a restaurant to eliminate the source. Fair?
It's usually when the public health, there's a risk to the public's health by practices that are occurring inside of the establishment.
And in that sense, then it's an establishment where you're seeing the disease specifically come out of the establishment in question, right?
It's where the practices that are being done in the facility are creating a public health hazard where disease is spreading from what the facility is doing.
Are you aware of recent OSHA guidance that have suggested that mask mandates are not effective because we're dealing with aerosols and not droplets when it comes to COVID-19?
I'm not aware of those.
Have you read the National Academy of Science Press February 23rd, 2021 article that revealed the COVID particles were aerosols, not droplets?
No, because we were looking at November.
I understand what the outcome was, but the testimony and the suggestion is this facility presented a public health risk. And if the science has revealed, subsequent science has revealed that that's not quite the case because we're dealing with aerosols, not droplets, it's relevant to whether or not this facility was a hazard. So the answer was, though, that you did not read that February 21 study. Fair?
Fair.
You indicated that you believe that the governor's interventions helped stop the spread of COVID-19, correct?
Correct.
And your testimony was also that other states that did not have those interventions did not have a drop-in case. Fair?
Can you rephrase that?
Yeah, I think your testimony was that states that did not have these public health interventions did not have a case drop into December, right?
Correct.
One of the states that I think is rather notorious for not having any mandates was South Dakota. Would you agree?
I've read that.
So your understanding is that South Dakota did not have any kind of public health mandates such as Kentucky, right?
Yes.
Are you aware that South Dakota's highest case rate was 1,855 new cases on November 14th, 2021?
I've not studied South Dakota's case history.
Okay. The testimony was that you looked at states that didn't have mandates. saying that you didn't consider South Dakota as one of those states?
What I said was that there is a chart on CDC's website that shows cases. And so when you look at Kentucky compared to other states, our increases were not as dramatic as other states on the chart.
So you were looking at, was this an aggregation of every state on that chart?
Every state is listed. Their curve, their epidemic curve is listed on that chart.
So you would have had to have observed South Dakota's, right?
I was only looking at Kentucky and the states above it. I was not looking for specific states, no.
Okay. Would it surprise you to know that South Dakota, notwithstanding not having mandates, actually had a substantial case drop, and by November 29th, 2020, was down to 801 cases?
I don't know anything about what was going on in South Dakota and what they were doing.
What states were you comparing Kentucky to then?
On that chart, you would have to look at the chart to see what states were above there. I don't have it in front of me right now.
So as you sit here today, you can't identify any particular state in which did not have mandates and had a case increase.
I don't know what states had what mandates at what time. So looking at the chart, even if I had it available to me, I could not tell you if that state had a mandate or not.
Well, without knowing that, you could not evaluate whether or not the mandates were effective, correct?
No. You can evaluate based on looking at the incidence rates of the cases. So just looking at the lines, the curves of the lines, and what happened to our case numbers.
You would have to compare the states that had mandates and the states that did not have mandates to figure out whether or not the mandates had any correlation with public health outcomes, correct?
You could look at it that way.
You would have to look at it that way to evaluate whether or not the mandates were effective, correct?
I was only looking at Kentucky's data. And so looking at Kentucky's data, we can know when the mandates were issued and then look to see what happened to the case incident rates after those mandates were issued.
Well, if every other state, including the ones that did not have mandates, had a similar curve, we could probably determine that the mandates had no outcome in terms of disease progression, correct?
No.
Are you familiar with the 1918 pandemic flu?
Yes.
You would agree with me that in that instance there was likewise, and by the way, there were not a lot of public health interventions in that pandemic, correct?
To my knowledge, there were mask mandates that were issued. There were other guidance that was issued by public health.
Guidance, okay. And are you familiar with that disease progression following a similar curve?
I would have to look at it. I will be honest, it's been several years since I've researched the 1918 pandemic.
Okay. As you sit here today, you don't know one way or the other.
Correct.
You indicated that the public health department had a pandemic response to H1N1. Fair?
Yes.
Was masking required across the state?
No.
Was 6-foot distancing required across the state?
It was recommended but not required.
Did we shut down restaurants throughout the state?
No.
I want to go back to Fayette County in November of 2020. I believe that you indicated that the case count or the incidence rate, I think when we looked at the chart, it was right around 70 per 100,000. Fair?
Yes, there was 14,000 cases at that point.
And so if just on average, if there were 100 people in a bar or restaurant like Brewed, that would correlate to approximately 0.07 people with COVID. Fair?
No, you're looking at 100,000 per population, so you can't extrapolate back that way.
Okay, so if Fayette County, I mean, we can. So Fayette County's population, I think, is 300.
Correct.
Okay, that's roughly 3.2, right?
Sure.
So that's, I think that would be about 210 people that had COVID throughout the entire Fayette County at the period in question, right?
That would be 220 people that had tested positive for COVID. There's no way to know, because not everyone's getting tested, how many people actually had COVID in the community at that point.
Okay, so it's an unknown. Fair?
Correct.
But in terms of what we knew, we know about 210 people tested positive, right?
Correct.
So if there were 100 people in Brewed, in a population, just the percentages, that's still a 0.07 people for those 100, right?
Of people that we knew had tested positive. You're looking at two different things there. You're looking at incidence rates, and then you're trying to extrapolate numbers, and that's not, because we know there's so many people that would have the disease that were not getting tested. You're only looking at numbers of people that were positive. So it's not an accurate way to depict that data.
There was significant concern about ICU and hospital beds at the beginning of the pandemic, correct?
Correct.
So much so that we set up field hospitals, including at Kroger Field in Fayette County, correct? Familiar with that?
Yeah. I was trying to remember, sorry.
To your knowledge, was a single one of those beds ever used?
Not to my knowledge.
Was it ever the case that the ICU usage in Fayette County got full?
I'm not the expert on the hospital preparedness program, but looking at the chart that we had up, we were approaching capacity of the state that at capacity.
Okay. You're familiar, I don't know, are you familiar that the Kentucky Hospital Association has put out data about bed usage throughout the pandemic?
Yes.
Are you familiar with what the data was on that in November of 2020?
No.
Okay. Without looking at the data, we really could not assess whether or not the ICU data or the ICU usage was at or near capacity, could we?
Can you rephrase that?
Yeah, without looking at the Kentucky Hospital Association data, we cannot accurately look at the hospital bed usage or even the ICU usage, right?
Right, but we were looking at that data.
Okay. Would it surprise you if I told you that it looked like hospital bed usage was around 60% in November of 2020 from the KHA data?
That's roughly what it looked like on the graph.
Okay, and the ICU usage was right around that same number?
Are you talking about just Lexington or for the state as a whole?
Well, I was looking at really the region in question. I think it was Region 5.
Region 5?
Yeah. The KHA data showed that, again, ICU usage was only at about 60%.
That's roughly what was reflected on the graph.
Okay. Let me ask, the governor lifted the restaurant mandate in mid-December of 2020, right?
Correct.
And yet case rates were increasing, right?
They began to increase around, if you look at the chart, around 2 weeks after that was lifted.
Right, and the governor did not put in another ban on all indoor dining after that point, did he?
No.
And your testimony was that nothing the governor did endangered Kentuckians, right?
Correct.
Okay. All right. Let me ask, I've got some studies. I just wanted to see if you had read them or not, peer-reviewed. Have you read the, I think it was received, revised, accepted, it looks like it was peer-reviewed 21 July 2020, the paper on a country-level analysis measuring the impact of government actions, country preparedness, and socioeconomic factors on COVID-19 mortality and related health outcomes?
What journal is that from?
Yeah, it is from, it's an Elsevier submission, and it looks like Science Direct. He was in eClinical Medicine.
I'm not familiar with that journal.
Okay. So that study indicated that mandates such as those enacted by the governor of Kentucky had no correlation with COVID-19. You're not familiar with that journal, right?
I'm not familiar with that journal.
You had the research paper, Effective School Closures on Mortality from Coronavirus Disease 2019, Old and New, by Ken Rice et al.
What journal is that from?
Look, Physics and Astronomy. Was it published by the University of Edinburgh?
I would not be looking at journals of physics. I mean,
How about the Frontiers in Public Health? It was an article. It looks like it was November 19, 2020 publication. COVID-19 mortality, a matter of vulnerability among nations facing limited margins of adaptation. Have you read that study?
again, what journal is that from?
Yeah, that's in Frontiers in Public Health.
I'm not familiar with that journal at all.
Okay. You have the Centers for Disease Control and Prevention, MMWR, recommendations and reports from...
I'm sorry. Could you slow down when you read that? Thank you. I'm still trying to write it.
Have you read the Centers for Disease Control and Prevention, MMWR? This is a CDC publication dated April 21st, 2017.
What's the which article in that? Because there's several that would be in that.
Yeah, so this is volume 66, number 1. It's recommendations and reports, and the title of it is Community Mitigation Guidelines to Prevent Pandemic Influenza, and it's 2017 publication.
I probably read that when it came out in 2017, but have not revisited that since.
Are you aware that even in that, it does not recommend full business shutdowns?
Like I said, it's probably been 6 years since I've read that.
I think your testimony was, in terms of this particular establishment, you're not familiar with their HVAC system and you have no personal knowledge about the particular risk that this particular bar may have had. Fair?
Fair.
I have nothing further from a cross-examination standpoint.
All right, thank you, Mr. Newton. Do you have any redirect?
Yes. Misty. So I want to return to your education. Can you restate what your education is?
I have a bachelor's degree in science and biology and public health and a master's degree in public administration community health.
Sorry, I'm getting some noise outside, so I had to mute my microphone. And in your background as an epidemiologist, can you explain sort of the what sort of epidemiological principles that you apply when you work through these meters?
Well, it's important, I think, to note that in order to be an epidemiologist 3 at the Kentucky Department for Public Health, you have to take at least epidemiology classes and at least 2 statistics classes. So there's a minimum qualification for that. So just because the degree is not public health does not mean that that those qualifications are not there. As far as to answer your question about my epidemiology experience, I've presented at several national conferences about different epidemiology investigations. I've been published in at least one journal and in a local publication. I've also presented at several state conferences and received several certificates over the course of my 15 years as an epidemiologist. And so, when you first start as an epidemiologist, you learn the principles of epidemiology, which is, we try to discover the cause of the outbreak and then mitigate the spread of the outbreak and to stop and slow the spread of the outbreak. So, taking those principles that you learn in school and then applying them over the last 18 years, there's a lot of, just like with any occupation, a lot of what you're doing is based on your experience in the field and those different outbreaks that you've investigated.
And so when you were confronted with the COVID-19 pandemic, what principles did you base your response to your recommendations on?
Right. So, in public health, we try to do the best that we can to protect the most people from becoming ill. And so we really looked at what measures were available to us in the face of not having a vaccine, not knowing when a vaccine could or would be available to the community, not having any treatments for this disease. What could we do to keep people safe and to keep the least number of people from dying as possible? And so when we worked with all of the different groups that we've had to work with, that was what we were looking at. What can we do to protect the most people possible in the face of something that we had no cure for and no treatment for?
And so how does having no cure and no treatment translate into the measures that were taken?
We, as I just stated, we were really trying to do the best we could to keep people safe and to keep people from becoming exposed to the disease. Because we know that Kentucky has very poor disparities in health. We're number one in the nation for asthma and diabetes. And so we knew that we had a very vulnerable population just day to day. And so we really were trying to do the best we could to keep the disease from spreading like wildfire through the community.
So you mentioned that you had to take into account the specifics of the population of Kentucky in your response. Is that a common practice in epidemiology?
Yes.
So how does that work typically, if comparing to other states?
So epidemiologists, we look at the population as a whole. We're not medical providers. We don't look at individual patients. We look at the population as a whole. And so all of the states have data on their populations that show, how healthy or unhealthy their populations are. And knowing what we knew about COVID and what we know further now, we knew that a lot of our population was going to be very vulnerable because of that. And that's just a part of epidemiology. Just like when we looked at other outbreaks I've worked, like the hepatitis A outbreak, we knew that was affecting the population of people who had been incarcerated and people who were injection drug users. And so we did initiatives to try to protect those people and that group of people.
Are there other factors that are weighed in other than the vulnerability of the population to specific illness or being immunocompromised from territory to territory?
Yeah, I think in this one, because it was a new virus, it was novel. We knew that no one had any immunity to it. We were really looking at the entire population as a whole. And so, yes, there were pockets that were going to be more susceptible to COVID, such as people with diabetes, people with obesity, people with asthma. But because everyone was equally susceptible because it's a new virus, we felt like we had to do these extreme measures in order to protect the most amount of people. I think that we really worked hard to try to do that, to protect the most amount of people we could.
And as are there any other variables that affect the incidence in your knowledge and sort of transmissibility of outbreaks in a territory, other than the health of the population?
Right. I think in this instance, the biggest factor was that this was a novel virus that no one had immunity to. And looking when we first started in COVID, they were saying it could be 2 years before we had a vaccine. We had no treatments for it. So we really felt like we needed to do what we could to protect everyone from the spread.
There were calls to have different sorts of responses and measures county to county. Is there a reason why that would be, or why those weren't adopted? So
Kentucky is a home rule state, and that means that the counties can have some ability to create their own regulations, their own rules, their own policies, whether that's through the local health department or the local and city county governments. And so, as a state, we tried to issue regulations that, went across the state, but local jurisdictions, could also issue regulations if they felt like it was necessary.
Mr. Weiss brought up South Dakota. Are you aware of any conditions in South Dakota that differ from Kentucky? Outside, are you aware of any conditions within South Dakota that would affect incidents as opposed to Kentucky?
I have not extensively studied South Carolina's population.
Are you aware of any that
South Dakota, sorry.
Are you aware of any sorts of concerns that could, from state to state, change?
Yeah, I mean, all states are different. All states have different populations. Population density, how closely people are crammed in, that varies from state to state. So states that are more in the Midwest, like North Dakota, South Dakota, obviously have less population density than in Kentucky.
How would population
even though they may have the
density?
same population number. So population density is just the number of people in a community. How densely those people are packed into that community. So, oftentimes in more rural areas, like even looking at Kentucky, far eastern and far western Kentucky, the population density is not what it is in Louisville or Lexington.
And how does population density affect the spread of the disease?
So the more densely packed a population is, the more chances you have for disease to spread. The more chances you have with interactions between individuals in the community.
So if there was a population that was more or less populous or population dense, would that change, or how would that change, if at all, the response?
I don't know how it would change the response, because we were looking at just doing regulation across the state, or mandates across the state. But, looking from an epidemiology side of it, we do know that there's a lot of literature out there that supports, when you're looking at disease spread, it's much more prevalent to have disease spread in denser populations than in not as dense populations.
And as far as H1N1, you said that you worked a bit on the response to H1N1, and that in that instance we didn't use the sort of extreme or severe sort of restrictions that were present here. Why is that?
So there were a couple of different reasons. The first one being that we did have an effective treatment for that in some pharmaceuticals. I'm trying to think of the non-brand name, but Tamiflu. We knew that Tamiflu worked against it. And so there was a treatment available that was seeming to be effective. We also know that it was not causing the mortality that COVID has been causing. And so, there was a little bit less concern about mass mortality from that. And we were able to get a vaccine out because it was a flu virus, and we have the capability to make flu vaccines very quickly. We were able to get a vaccine out for that. I think the first cases were in the United States in April, and we were vaccinating individuals in September. So it was a very, very quick turnaround, much, much quicker than COVID.
And so what sort of interventions were adopted for H1N1?
So for H1N1, some of them were the same. So in long-term care facilities, we asked them to not do visitation. We asked them to not do communal activities. Same thing with correctional facilities. We worked with the schools to do hand washing, cough covering campaigns. I think when those first cases showed up in April, I don't think Kentucky got the first cases based on anyone until sometime in May. And so, schools were going out. So as schools came back in, we really pushed those hand hygiene messages and covering your cough. But at that point, we were almost ready to roll out a vaccine to those individuals.
Understood. Mr. Weiss brought up that the research is showing that it's aerosols and not droplets. Can you explain the difference there?
So droplets are heavier and fatter. They fall down out of your mouth to the ground a lot quicker than aerosols, which can linger in the air. Okay.
And with aerosols, is social distancing ineffective against the spread?
It's not as effective. Social distancing is always an effective way to prevent the transmission of diseases, but it's not as effective against aerosols as against droplets.
And is masking ineffective against aerosols?
No. Like I said, the point of masking is to keep your germs to yourself. So because they're smaller, they may, if your mask is not on correctly or it's not double layered like it's supposed to be, you could have some additional aerosol droplets, or not droplets, aerosols that are able to escape it. But for the most part, it is still the most effective strategy of keeping your droplets and aerosols to yourself.
Social distancing and masking?
Yes.
With that in mind, there was talk about the use of proper ventilation or ventilation systems that may destroy. I know you said that you aren't an industrial hygienist, but does the evidence show that, does the evidence show that the measures taken, despite there being potentially other methods, were effective at all?
Yes.
Wouldn't the research find that it was more in aerosols and not in droplets?
The most recent literature on that has been coming out, early this year, February, March. Like with any disease, the further we go along with it, the more we learn. Science is an ever evolving process, and so the more we go forward, the more we're learning about how this disease is transmitted and what it potentially can do to those that are infected with it.
So, what effect does that changing knowledge have on measures that are adopted?
I think that it as we move forward, we've adopted and we've changed things as needed to match the science and to match what's going on in the area. So, I think the biggest thing that's made the biggest change is the vaccine coming out. The reason that things can be lifted and we can start to return a little bit to normal is the vaccine, and not in November. In November, it did not look like it was going to be available. For at least a couple of months, and we were able to roll that out in December. I think I think you're muted.
If I could, I'd like to introduce Ms. Boland's CV as an exhibit.
I object. It was not disclosed in evidence.
I'm going to let you submit it, but then I will package this with the other consideration related to the determination of whether or not she will be labeled as an expert witness.
Okay.
Just for the record, this is violating the pretrial order in this case. So I just wanted to make that clear for the record.
I think it fits under the C as far as like when it was submitted as documents or other evidence necessary for impeachment or rebuttal. But this is definitely a part of the consideration that's been discussed since the beginning of this hearing as far as Ms. Boland's credentials and how they will be viewed with the testimony. So I will allow the entry of it in for that consideration, knowing that it's going to be determined as a whole as to whether she'll be labeled as an expert.
And I have nothing further. I can provide that to Mr. Wiest and to the hearing officer as well.
That would be fine. I mean, I'm sure Mr. Wiest may have written objections that will accompany that, but if you could get that to both of us, that'd be appreciated. Your redirect for Ms. Boland.
You broke up a little bit.
Mr. Newton, are you still cross-examining Ms. Boland? Or
no, I have no further questions. I'm sorry.
Okay, sorry. Mr. Wiest, do you have any recross?
I do. Ma'am, your testimony was that you published one journal. What journal did you you published in one journal? What did you publish and when?
I'm pulling my CV. I was published in the American Public Health Association in their annual conference literature.
What year?
2006.
And what was that publication on?
Competency-based education for preparedness staff. And I was also published in Kentucky's Epidemiological News and Notes and Reports.
What year?
October 2005.
On what?
Investigation of an outbreak of skin rashes in Carter County schools.
You've not been published on COVID-19?
Correct.
Some additional public health outcomes, and let's talk about some of those because I think you talked about public health outcomes. Would you agree that unemployment is a adverse, at least adverse public health consequences?
I don't. That's not something that I've studied.
How about increased cases of depression? Has that led to adverse health outcomes, public health outcomes?
I'm not a behavioral health expert.
Increased rates of suicide, has that led to any adverse public health outcomes?
Again, I'm not a behavioral health expert or epidemiologist.
You know whether or not we've seen increases in all of those things as a consequence of the public health interventions that we talked about here this morning?
I'm not in the behavioral health part of the cabinet.
Part of your testimony was that H1N1's vaccine was available far quicker than the COVID vaccine, correct?
Correct.
Okay. And you said that H1N1 came out in April of 19 and the vaccine began in September of 19, correct?
No, it was 2009.
2009. Okay. So April
Correct.
2009 to September 2009 was the H1N1 vaccine?
Correct.
Okay, that's 9 months, correct?
No.
So April, May, June, July,
It was
August, September.
6.
5 months. Okay.
Yeah.
6 months. Okay. And COVID, I think we first saw that in March of 2020. in Kentucky, anyways, right?
in Kentucky.
And the vaccine, I think you indicated, was available in December of 2020.
Mid-December of 2020.
Okay, so that's about 10 months.
Correct.
You indicated that there's been no effective treatment for COVID. Fair?
I said that when we were looking at deploying these, that were not effective treatments identified.
Okay. And in addition to the vaccine, are you aware of multi-drug treatment that's been employed for COVID?
Yes.
Okay. Has that been effective?
In some individuals, but not overall, and not for all cases.
Okay. Are you familiar with a study entitled Multifaceted, Highly Targeted Sequential Multi-Drug Treatment of Early Ambulatory High-Risk SARS-CoV-2 Infection? It was published in Cardiovascular Medicine, December 30th, 2020.
I'm not a physician, so I would not have read a study like that.
Are you aware that masks do not meet key OSHA respiratory protection standards?
I'm not an industrial hygienist, so I don't know about OSHA.
Okay. Right. And I think you've testified you're not familiar with the National Academy of Sciences Press, the February 23rd, 2021 study, correct?
Correct.
And so you're not able to comment on the findings in that study that masks, because of aerosols, are ineffective, correct?
Correct.
Okay. And I think that concludes my recross.
All right. I'll see if Mr. Newton has anything further, Mr. Newton.
Nothing further.
All right. Do you anticipate having to recall Ms. Bolin?
No, I do not.
Okay. Ms. Bolin, unless maybe somebody specifically calls you back, you are excused for right now. Thank you so much for being here. I appreciate your presence. Thank you.
Thank you.
Thank you, Mark.
You are excused. All right, it's 11:04. What is the next witness you intend to call, Mr. Newton?
I believe it's Karen Sanders.
Okay, is she still present in the waiting room? I guess what I want to check in, I know it's hard to have an idea always of how long anything takes, but do you believe that at least your direct will be wrapped up, I guess, around 12, lunchtime?
I'm actually directing that witness, and I do
Okay.
think that the direct could be handled in less than an hour. I would still like to take just like a 5-minute break before we call her, if that's possible.
That's possible. Mr. Wiest, I assume you're okay with a short break?
I am. I have a hard stop at 3:00. I have a call this afternoon that I have to take. And it's been on the counter. I was hopeful we would get through this whole hearing by then. So I don't have a problem with a short break, but hopefully we can get through this.
I will say too, like, I'm fine with a short lunch if everybody else is okay with that, just to keep this rolling. So why don't we do that? We'll do a 5-minute break, come back at 11:10, and then I'm going to go ahead and bring Ms. Sanders into the room, okay? And let the other witnesses know where we're at.
Thank you.
Tim, I'm going to go off the record. The time is 11:05 a.m.
Ms. Sanders, I'm bringing you back in. We're about to take a break, but I wanted you to know that you're next. I'm going to let the others in the waiting room. We're going to start your testimony at 11:10. So we'll be back then, and we'll have you on camera, hopefully. Other than that, I'm going to also go on break. Thank you, everyone.
Thank you.
Hold on.
And
Hold on. I went to. I need to spotlight her. Okay. I'm back on the record. The time is 11:11 a.m.
All right, Ms. Sanders, I'm going to ask you to raise your right hand. If you could hit on me, thank you. You swear or affirm the testimony you're about to give is the whole truth and nothing but the truth?
Yes.
Ms. Foster, it's your witness.
Hello, can you state your name for the record, please?
Karen Sanders.
And how are you employed?
I work for the Lexington-Fayette County Health Department.
How many years of experience do you have in that?
I have multiple years of experience starting since 2007 working in Maricopa County, Arizona.
Do you have any certifications?
Yes, I'm a registered environmental health specialist, registered sanitarian through the National Environmental Health Association, and I just received reciprocity for a registered sanitarian with the state of Kentucky.
What does your job entail?
Routine inspections for restaurants, swimming pools, public accommodations, doing complaint inspections, doing opening inspections, conducting food board illness inspections.
What led you to visit Brewed on November 24th, 2020?
They were due for a routine inspection.
And how did that inspection come to be assigned to you?
During our team meeting, we go through and assign 1, 2, 3, 4 for the inspectors, and that was one of the restaurants that I was assigned.
So it's just a random assignment?
Yes.
Had you received any complaints prior to that time about Brewed?
No.
What did you observe on that day?
I arrived, and when I went up to the door to look at their score sheet or their scorecard, they had a sign that said that they were open and that they had a garage door, which made them be considered a patio. I went into their facility and to go to the front counter to speak to the employee there, and I noticed that there were customers inside the facility at that time.
Was that surprising to you?
Yes, as that was one of the first few days of the closure for in-person dining.
Okay. What happened when you spoke to staff?
I let at the time I didn't know it was Mr. Cooperrider. I just went up and let them know that I was with the health department. I was there for a routine inspection, and I let them know that they needed to be closed to in-person dining.
What was their response?
He said that he had a garage door and therefore could be open, as he considered it as a open patio.
What did you do in response?
I let him know that what was considered outdoor dining would be having more than 50% or more of your outside walls open to the air.
I'm going to share my screen here so that I can show a document to the witness. Can you see this document, Ms. Sanders?
Yes.
Does this look familiar to you?
Yes, that's my handwriting.
Can you explain to us what this document is?
It's a notice to correct, and it's something that we give to facilities if we see something that is against one of the codes. And as you can see there, it was for the Executive Order 2020-586, the Kentucky Healthy at Work requirements. And that was something that we give to them whenever we observe those violations.
Okay. Did you provide a copy of this notice to Mr. Cooperrider?
I believe at the end of our time there, Skip Castleman provided copies because he took the copies that I had.
Did you ask him to sign this?
I did at one point, yes.
And what was his response?
He said he didn't want to sign something that he didn't agree with, so he was not going to sign it.
Okay. Your Honor, I move to introduce this. I'm not sure where we are in the exhibit numbering.
Yes, potentially it's Exhibit 3, but Mr. Wiest?
I object on the basis that all of this was ultimately rescinded by the health department because we got into a dispute with them over the fact that exemptions applied, and the inspector in question never verified that the exemptions applied, and it was rescinded by agreement. And so this is a non-valid document as far as I'm concerned, and I object to it on that basis.
If I may respond to that, I would say that's certainly something that counsel is entitled to argue in his closing, but this document was generated on the day that she went into the facility. It captures her impressions on that day and records them in her own handwriting. I think it assists the court in knowing what occurred on that day as part of just our facts about what she observed and that a violation was occurring at that time. Whether or not they ultimately reached some other outcome between the health department and Mr. Cooperrider in court doesn't in any way undermine the observations that are recorded in this document.
So I would say this in response. There was a dispute about exemptions that applied. And maybe I need to deal with it on cross, and I suppose I can, but and we've already kind of dealt with it in cross there was a state court action that ended up being dismissed as well. But I think it's irrelevant unless, it certainly doesn't establish a violation in my view, but I suppose I could also deal with it on cross.
I'm going to overrule the objection and let it be entered as just the record that was used that day. I understand there's many distinctions, and it sounds like the argument is going to come forth either through cross of this witness and possibly other evidence. So, but I've noted the basis of your objection, Mr. Wiest. Thank you. You can Ms. Foster.
What is the exhibit number that's been assigned to this, so I make sure I keep them straight?
For now, I'm just going to go ahead with 3, like the third that's been mentioned. And so if it has to be renumbered, we can work with that later, but we'll call Exhibit 3.
Okay. Now, Ms. Sanders, when you provided Mr. Cooperrider with this notice to correct, at that time, were you going to shut down his indoor dining?
I was, with this particular piece of paperwork, that did not, that had nothing to do with the indoor dining. That's a different piece of paper. That would be a different document.
I'm gonna show you another document. And I guess before I get to that, so after you showed him or provided him with a notice of correct, what was his response to you about closing to indoor dining?
He said that when we went behind the counter and we were speaking, he said that he was calling his lawyer, and that he was going to be in contact with them concerning it, that the police department had already stated that they weren't going to support us. So he wanted to know what was going to be done. I just let him know that I needed to give him the 2 documents, the notice to correct and the notice of enforcement, and that this was an opportunity for him to stay open if he stopped the indoor dining.
And what was his response to that?
That he would speak to, that he was refusing to sign all of the documentation that I had. I let him know that I would call and speak to my supervisor to find out what next steps they would like me to take if he was not going to stop the indoor, not close, but to stop the indoor dining.
Okay, and what happened next?
I went out to my vehicle, spoke to Luke and Skip, let them know what was happening. While I was in there with Mr. Cooper Ryder in the restaurant, I was on the phone with Skip, and Skip let me know that he could refuse to sign, and that he was on his way, and that if Mr. Cooper Ryder's lawyer wanted to speak to Skip when he got there, that would be perfectly fine. So I went out to my car to wait for Skip to arrive.
Okay. Did you fill out any paperwork in your car?
Just the first 2 pages. When I first went in to start what would have been just a regular routine inspection, I noticed those things that were occurring, and Mr. Cooper Ryder let me know that he didn't want to stop the in-person dining. So I went out to my car to fill out the paperwork, and then I came back in, attempted to serve him the paperwork, and then I went back out to my vehicle to wait for Skip.
Let's see. I have another document that I want to show you. Can everyone see this document?
Yes.
Okay. Ms. Sanders, do you recognize this document?
Yes.
Is this your handwriting?
Yes, it is.
Can you explain to us what this document is?
It's a notice of enforcement. And we use that for if we need to ask someone to cease doing something, suspend their permit, revoke their permit. That's the main thing we use it for.
So would you say this is the next step after someone's received a notice to correct?
It can be. It just depends on what we're dealing with. With that, the next step for them, that was just my observations of them not having, or them still having in-person dining and not closed to in-person dining.
Okay, and I move to introduce this exhibit as well.
Mr. Reese?
No objection on this one.
All right. It will be entered. This one will be number 4, tentatively. So, thank you. You may proceed, Ms. Foster.
And when you provided this document to Mr. Cooper Ryder, what was his response?
That he was not going to stop, that he felt that his garage door would account for the 50% and meet the guidelines.
Did you observe his garage door at that time?
I do not remember seeing it open, but I do remember seeing the garage door, and it did not equate to 50% or more of the outside of his facility.
I have another exhibit here that I would like to show this witness. Ms. Sanders, do you recognize the building in this photograph?
Yes, it's the Brewed coffee shop.
Is this reasonably similar to how it appeared on the day of your visit in November last year?
Yes.
And I'm going to use my cursor since we're kind of limited here. But is this the garage door?
Yes.
Okay. At the time, with the Healthy at Work standards, would having that garage door open all the way have allowed Mr. Cooper Ryder to remain providing in-person dining at his facility?
Not on the inside, no.
Okay. Your Honor, I move to introduce this as Exhibit 5.
Ms. Reese?
I didn't hear her say, when was the photo taken?
Well, she didn't take the photo. But she verified that that is the establishment. This was provided with our compliance, and there was no objection.
I don't know that the foundation's been laid for this exhibit.
I'll take that under submission. I mean, she has provided plenty of testimony just based on her recollection of the events. And this was, helped her discuss it, but I will take that under submission. So if it's entered, then it will be number 5. But other than that, I guess we can move forward. Thank you.
Okay, Ms. Sanders, just to roll back a moment. So you had gone to your car and filled out the notice of enforcement, and you had called your supervisor. What happened next?
I waited for Skip to arrive because at that point there was no further action that I could take. So I waited for Skip to arrive, and when he arrived, I showed him the paperwork that I had filled out with the refuse to sign documented, and let him know what had occurred. Let him know that there were people filming us while we were in there, and we entered the establishment so that he could speak with the employees and with Mr. Cooperrider.
Okay, tell me more about that. When you had gone in previously with the notice, what occurred inside the premises as it relates to customers and employees?
When I first entered, as soon as I started speaking with Mr. Cooperrider, a few gentlemen came up and started asking me who I was, what I was doing there, why I was there. I let them know that I was with the health department. I gave them my name, let them know I was there to do a routine inspection. They started filming while I was talking to Mr. Cooperrider, getting closer than I'm used to customers getting while I'm doing an inspection. Then I left the facility to fill out the paperwork. When I came back in, Mr. Cooperrider was making some coffees. There was a woman standing at the counter. People were still sitting at their tables. When I was waiting for Mr. Cooperrider to finish making his coffees, the gentleman behind me started talking and filming, and the lady in front of me at the counter started filming. They were both talking at me. And while I was waiting for Mr. Cooperrider to finish making his coffees, I didn't feel comfortable with having people behind me, so I walked around so that I was able to see Mr. Cooperrider and the customers.
Is that something that normally happens when you go in to do an inspection of a location?
No, most people don't notice us.
How did that make you feel?
Very uncomfortable. Most interaction I have when I'm at a facility is with the permit holder and their employees. Most of the time, the only thing I've been asked is how to properly thaw something by a customer. Definitely not questioned as to what I'm doing there.
So what happened after Mr. Castleman arrived?
We went in, Skip reviewed the paperwork that I had given them. Mr. Cooperrider, I can't remember if it was Mr. Cooperrider or the female that was working there, let us know that they weren't going to be closing down for the in-person dining, and that asked what would happen if they refused to close. I believe Skip told them that they would have to ask for a hearing. If they still refused to close, that they could request a hearing. But that the next step, if they still refuse to close, would be a closure, a suspension of their permit.
And did they agree to close?
No.
What happened after that?
So we went out to our cars so that Skip could discuss things with Luke.
And who is Luke?
Luke is our supervisor, both mine and Skip's supervisor. And during that time, a gentleman was filming us. throwing questions at us about what kind of patriots we were, and military service and things like that, filming our personal vehicles while we were standing next to them.
I'm going to object to the hearsay. This isn't a witness, this isn't a person by the company that was making these statements. It was a third party, and I don't think it has anything to do with this case.
I mean, she's testifying as to her own observations.
Sure, but
and it does have to do with the case, because the case is about a disorderly premises and the failure to follow the rules, and certainly allowing customers to intimidate people that are just doing their jobs and giving notices does play into that. And we can make arguments on that later.
So her testimony was this was the parking lot. This was not within the premises itself, and I think it's irrelevant. It's a 403 issue. It's not admissible. It's hearsay. I mean, there's all kinds of problems.
I'm going to allow the testimony as, under 13B, hearsay is admissible. The difference, distinction being that when a finding is being made, it cannot be made solely on hearsay that's been admitted into the record. So the testimony is allowable under the KRS 13B statute. So I'll let the questions continue. Ms. Foster.
Okay, so after you guys have filled out the paperwork in the parking lot, what happened next?
We went back in so that he could serve the second enforcement notice. I did not do, from the point Skip arrived to the time we left, I did not fill out or hand out any other paperwork. At that point, it was Skip that took over the enforcement actions.
And did you guys, in fact, close the business on this date?
Yes, there was a closed, I believe it was a final notice of enforcement. Again, I didn't fill out that paperwork, so I can't speak. I can't remember exactly what order that was, but Skip did post a closure sign and let them know that they were closed.
And what happened when you left the premises?
Mr. Cooper Ryder and his employees followed us out. I mean, not the employees, I'm sorry, let me rephrase that. Mr. Cooper Ryder and the customers followed us out to our vehicles, throwing questions at us and things. They followed us. Skip, as we were walking out, Skip told me just to get in my car and go. When I went to get in my vehicle, I wasn't able to back out because there was a gentleman filming the interaction that was blocking my ability to back up. When I got out of the vehicle to ask him to move so that I could leave, that's when I started hearing Mr. Cooper Ryder yelling at Skip and started cussing at him, and everyone was just yelling and getting very loud. And as soon as the gentleman moved, I got back in my car. I backed out of the parking lot and left. And I called Luke to let him know what was happening and to ask what if I should, because I was concerned that it might possibly get violent. So I needed to know if I had, if I should call 911 if I witnessed any of that.
Okay. While this order of closure to indoor dining was in effect, did you have any other inspections that occurred where businesses were open to indoor dining?
I only had one.
And what happened briefly when you spoke to that owner?
I let him know that his garage door that he had opened did not meet the 50% rule.
I'm sorry. I think maybe you misunderstood my question.
Oh, I'm sorry.
I was asking if there were any other businesses that you encountered during the closure of indoor dining that were remaining open.
Yes, and they actually had a garage door as well. Sorry.
Okay.
I'm sorry. They had a garage door as well that was open that they thought met the requirements. I let them know that wasn't possible. They immediately told their servers to not seat anyone and switched back to carry out and take out only.
Okay. Now, I know that you guys had issued these notices of enforcement, or you've testified that those were issued. Did this case end up going to court?
It did, yes.
Did you have to testify in that matter?
Yes, I did.
Are you aware of whether or not the court issued a ruling that Mr. Cooperrider needed to close his business?
I understand that there were rulings. As to what those were, to be perfectly honest, as soon as that day was over, I tried to step back after the testimony because at that point it was above my pay grade for how things were being handled.
Okay. All right. I have no further questions for this witness at this time.
Great. Mr. Wiest?
Good afternoon, Ms. Sanders. Let me ask I'm going to start with the mask mandate. You said that the mask violation that you wrote, you thought was a violation of Executive Order 2025-86. Fair?
I'm sorry, my screen just went blank. I'm sorry, 2 seconds. I'm not sure what just happened. Okay, sorry about that.
You said that it was your recollection that the mask violation that you wrote for Brewed was a violation of 2025-86, correct?
That's the executive order and the Kentucky Healthy at Work. That is what I was instructed to put on any mask mandate.
And you testified about that in circuit court in Fayette County as well, correct?
Yes.
And do you remember me asking you in that case whether or not you determined whether or not any exemptions applied to the customers that you saw without masks?
Yes, I did.
You said you did not determine whether or not an exemption applied, correct?
No, I did not, sir.
And the same is true for anyone that you saw not wearing a mask. You're not sure whether or not an exemption applied, correct?
The only thing that I was told by Mr. Cooperrider was that he had asked his employees or his customers to wear masks in the past, and they said that they weren't going to, and he couldn't make them. That is the only thing that I know in terms of his customers not wearing masks.
But in terms of what you observed that day, you don't know whether or not those folks that you saw without masks were the subject of a valid exemption, correct?
No.
That is correct, right? You don't know.
Yes, that's correct. I'm sorry.
And there were exemptions, I believe, for people who have disabilities or physical or mental impairment that prevents them from safely wearing a face covering, correct?
Again, I don't have a copy of the.
Let's look at it. Yeah, that's fine. I'm going to put it up in front of you. It'll be helpful for probably everyone. So let's look at just for purposes of there's the executive order, right? It's been in effect since July of 2020.
Okay.
Again, the following are exempt from wearing a face covering, and there is what I just read to you: a person with disability or physical or mental impairment that prevents them from safely wearing a face covering. Correct?
Yes.
So we don't know, as we sit here today, whether or not there was in fact a mask violation without knowing whether or not the people were the subject of an exemption. Fair?
Correct.
I want to get back to the food shutdown issue. And do you recall Mr. Cooperrider indicating that he was operating under the event space requirements?
That was never mentioned to me at any time that day, sir.
Okay. And whether or not he ever took that position?
Not to me. I never heard that. That was never mentioned to me on that day, no.
Let's just take a quick look at, I think it was Executive Order 2020-968, correct? Right? Wasn't that the executive order that shut down indoor dining?
I don't have the number in front of me, so I'm sorry.
We can go look at it. I don't think I'm going to introduce it, but I want to, if I can find it. To be clear, this was the Governor's Executive Order, November 18th, 2020. Do you see that?
Yes.
And it did shut down indoor dining for restaurants and bars, correct?
Yes.
But it also allowed venues and event spaces to continue to operate as long as they had 25 people or less. Fair?
Yes.
Okay. Did you witness more than 25 people in the room on the date in question?
I don't remember counting the number because what I had in front of me that he was operating as a restaurant, and any any in-person dining at that point wouldn't have been allowed.
Even though the order itself indicated that indoor venues, if it was an event space, could have 25 people per room?
I was never told by anyone, including Mr. Cooper Ryder, that he was an event space.
Let me ask, when you first came in, did you tell Mr. Cooper Ryder that you were uncomfortable?
Not at that time, but when we stepped behind to speak with him, and when I was having him sign the paperwork, I let him know that I was uncomfortable. Yes.
And when you did that, he brought you into the kitchen so you weren't exposed to anyone in the
No, that was mentioned after I asked him if we could go back behind. I asked if we could go back behind, and then I let him know that the filming was making me uncomfortable.
In response to that, he allowed you to go back into the kitchen with him to have the discussion, correct?
And when I asked him if we could go back behind, yes, but at that point I had not mentioned that I was uncomfortable. No.
The people in there were two groups in there that day, correct?
I don't know how many groups were in there, sir. I'm sorry.
You know whether or not the people in there were appropriately engaged in appropriate 6-foot physical distancing?
There were times when people I felt were closer to me than 6 feet. As concerning who was grouped with who, that I couldn't tell you.
Did you measure it?
No, sir.
Okay. Do you know whether or not anyone within the restaurant that day had a COVID diagnosis?
No, sir.
And as I understand it, let me ask, did anyone yell at you within the restaurant premises itself?
Yes. When Skip was issuing the final enforcement notice and the letting him know that we'll be putting up the closure sign, people started yelling. Somebody was yelling out, make sure you ask for a hearing, and some other things. So yes, there were customers yelling at us.
They were yelling about the contents of it and what Mr. Cooper Ryder should do in response?
Yes.
Okay. Did any of them threaten you personally?
No, there was no threat of violence spoken, no.
How many square feet is the facility?
I don't know, sir.
Do you know what HVAC equipment or systems they had in place?
No, sir.
When you first came in, was the garage door open?
I do not recall seeing it open. It wasn't open significantly enough for me to realize that it was an open garage door. It was not fully open.
I think I asked you, so I just want to be clear. You don't know what the HVAC systems that they had in place that day were, fair?
Yeah, no, I do not know that.
To be a threat to be a threat in terms of COVID spreading, somebody would have to have COVID within the facility itself, wouldn't they?
To catch a disease, you would have to be around someone that had the disease, correct?
I think your testimony was we don't know whether anyone there that day actually had a diagnosis, correct?
No, sir.
Let me ask, and I know you're not familiar with the corridor itself, but was anyone there serving or drinking alcohol that day?
I do not know. I only saw Mr. Cooper Ryder preparing coffees.
Okay. Let me make sure. I think you testified Mr. Cooper Ryder raised his voice at one point in time and may have used a profane word. Was that outside?
Yes, it was.
It was in the parking lot, not within the confines of the 4 walls of the facility?
Correct. It was next to Skip Castleman's vehicle.
Did he threaten Skip in any way? Did he threaten him with violence?
To be honest, sir, as soon as I heard the screaming and the cussing, and I got in my vehicle and exited as quickly as possible because I did not feel safe.
Did anyone brandish a weapon?
I do not remember seeing a weapon, no.
Would that be something that if someone did, you would have remembered probably?
If I saw a weapon, I'm sure I would have remembered it. Yes, I do not remember a weapon.
Did Mr. Cooper Ryder make any gestures of violence towards Skip in any way that you saw?
He was throwing his arms around while he was talking.
Because he was upset?
I can't speak to his state of mind, sir.
Okay. If he's raising his arms and was he saying that he wanted a hearing?
At one point while we were inside, I do recall him asking for a hearing as we were walking out, yes.
Did he indicate that Skip was his frustration that this closure could result in the shutdown of his business?
He repeated that multiple times because he said he wasn't Starbucks.
And so he basically indicated he could not stay open because of this order? Was that why he was screaming?
He indicated that was his feeling that if he closed to indoor dining that he could not provide enough business, yes.
And that was primarily what he was screaming?
Like I said, I don't remember all of it.
Objection. This is asked and answered. He's asked her several times what he said, and she's repeated herself numerous times.
Any response, Mr. Wiest?
Yeah, I'm trying to get to the answer here, and I don't know that it really has been answered. I'm trying to get into the specifics of this. Obviously, the claim by the other side is that, that this all gives rise to a disorderly premises and whatnot. And I think getting the context of what exactly was being screamed, if you will, is important. Context always matters. So I think getting to the heart of this is critical, and I don't know that it's been flushed out yet.
I will overrule because I do think that there's been enough variation to say that it's not the same exact question, and it does seem like each answer provides a little bit more information or different information. So I'll let Mr. Wiest continue, but I think you see that it needs to move forward too.
Ma'am, other than concern about being able to remain open, and I think you said he indicated he used a one-time used a profane word. Did he scream anything else out that sticks in your mind as we sit here today in terms of the content of the speech?
No, sir. As soon as I got out of my car, started hearing the yelling, and the gentleman finally moved after I asked him to because he was filming. I got back in my vehicle and I exited as quickly as possible.
And you don't know what, if anything, Mr. Cooper Ryder did in response to the individual in question, correct? Following that?
I'm sorry. Are you meaning what he did to Skip?
No, I mean after the guy that was blocking. Do you know whether or not he asked the guy to move?
I asked the gentleman to move, and he moved.
If Mr. Cooper Ryder, after all that, asked the gentleman to leave or not?
I pulled away and drove away, and I pulled off. I didn't make it to the main road, but I pulled away far enough that I could call Luke to see if I needed to call 911 in case things got violent. As soon as Skip got in his car and was able to exit the parking lot, I drove the rest of the way away from the building.
Okay. I do not believe I have anything further.
Okay, Ms. Foster, do you have any redirect?
I do. I have some brief redirect. You were just asked, Ms. Sanders, whether or not you were aware if customers inside the building had exemptions not to wear masks.
Correct.
Whose responsibility is it to determine whether or not somebody has an exemption?
According to the way that I was taught and trained, that would be up to the permit holder because they are the ones that are legally responsible for their facilities.
And on this date, wasn't the business supposed to be closed to indoor dining?
Yes.
So it really wouldn't matter if people had an excuse not to be wearing a mask because they weren't supposed to be inside the facility on that day. Is that correct?
In terms of the indoor dining, no one should have been there.
When you arrived, you said you were there to complete an inspection. Were you able to do the inspection?
No. As soon as the closure notice was issued, as soon as there was evidence that there was going to be no closure for in-person dining, and once we had to issue the closure notice, there was no reason to inspect that day.
Did you notice whether or not the restaurant was serving drinks and food to customers?
I know that coffee was served. Yes.
And during these events that we've heard testimony about with the customers interfering and yelling, did the owner, Mr. Cooperrider, or any other employees try to calm the customers or ask them to step away so that he could speak with you and conduct business?
Not that I remember.
All right, thank you. I have no further questions for this witness.
Mr. Wiest, any recross?
Yeah, just a brief question, ma'am. This event was about 7 months ago. Fair?
Yes.
Do you remember every detail of every interaction you had from 7 months ago?
No, sir. But when I feel nervous or threatened, I tend to remember things a little more clearly.
You think as you sit here today that you remembered every single detail of that interaction?
Unfortunately, I do not have that kind of memory. No.
Thank you. Nothing further.
All right, Ms. Foster, do you plan on recalling Ms. Sanders, or is she excused as far as ABC is concerned?
I think this witness may be excused.
All right, thank you so much, Ms. Sanders, for being here today. I appreciate your presence and cooperation. Thank you.
Thank you.
All right, you're excused. We're at 11:52, and I think this would be a good time to break for lunch, and then we can bring the next witness, either Mr. Castleman or Ms. Estes. Are you aware, Ms. Foster, of which party is going to be called next?
Yes, Mr. Castleman will be called next, and I anticipate his testimony is going to take, at least as long as Ms. Sanders did.
Okay. Mr. Wiest, any concerns before we break?
I mean, again, I've got a 3 o'clock hard stop, and I think we are getting long in the day. I hope we can get through it. I hope we, I would prefer to take a short break and then proceed because, and I'm guessing what we're going to hear is duplicative of what we just heard, but it seems like we're going long in the day. So.
Okay. Well, we'll be back. Let's say at 12:30. I think that would be long enough for everyone to get lunch, and then we can promptly start at 12:30 and then get this going. Okay. All right. Thank you, everyone. We'll see you at 12:30.
Are we just going off the record, or are we going to stay on and just come back in a half hour?
We can go
Do
off.
I need to log back in?
Say what?
Do I need to log back in?
Oh, no, I'll leave the Zoom room up if that's your question. So we'll just stop there, and then, I'll have the Zoom room so that people can remain or leave, or, I'll let them back in probably at 12:20.
Okay. I'm going to go off the record then. The time is 11:54 a.m.
Thank you.
Thank you.
void of any noise or extra noise, I'd appreciate it. But other than that, thank you.
And Ms. Stevens, while we were on lunch break, I've got a call with some folks in Washington, D.C. at 3 o'clock. I am informed that I will be done with that call by 3:30. So
we have
I just may need to take a break.
one
3:30, if that's okay.
That's fine. I can accommodate that. I still like the goal of shooting for being done by 3, though, if we could. So, if
Robert, do you mind?
If that's possible, I would be happy with that too. I have a preschool graduation tonight.
Miss Roberts, I'm not sure.
Yeah, and I have a seminar that I'm taking at 6 o'clock. So
Right, yeah. So, and it's Friday, so I'm sure we'd all be like to be finished sooner than later. But I'll keep that in mind. No matter what, we'll break, so you can do that call at 3. Okay.
Thank you.
Other than that, I've already admitted Mr. Castleman, and so I think we are ready. Ms. Foster, are you conducting the direct?
Yes, I am. I do see that. I think we're still showing that we are currently off the record screen. I just want to make sure I'm going to be able to share screen.
yeah, you will be. Sorry, I haven't taken it off.
Oh, it's okay. I think she was waiting for me to make the call.
Okay.
We are otherwise ready.
Just want to make sure. I'm not the best guru on this. So
Let me.
Just ready
Councilman,
to.
if you could unmute and start your video, we're going to call you next. Thank you. And then whenever you're ready, I'll swear him in. Ms. Domenico.
Yeah, just a second. I'm going to spotlight him too, so he doesn't bounce around. I don't know if that changes his view. He'll have to toggle through his gallery view if he can, so he can see everyone.
I mean, I think it's fine. It's the spotlight is clearly on. So if you need to hit what looks like a waffle up in the right top corner, that can change the view to where you can see everybody, Mr. Castleman, if you need to see everybody as they're talking to you.
Right.
All right. If you'll raise your hand.
Hold on, let me go on the record and see if I just.
Oh, I'm sorry.
I'm back on the record. The time is 12:33 p.m.
All right. We have our next witness, Mr. Castleman. Do you swear from the testimony you're about to give us the whole truth, nothing but the truth?
Yes, I do.
All right. Thank you. Ms. Foster, your witness.
can you state your name for the record, please?
Denny Castleman. I go by Skip.
And how are you employed?
I work for the Lexington and Fayette County Health Department as the environmental coordinator.
How many years experience do you have in that position?
12.
Okay. Do you have any certifications?
I'm a registered sanitarian.
And what does your, oh, I'm sorry.
As registered sanitarian and a couple others, but that's the one that's applicable to this case.
And what does your job entail?
Primarily, I coordinate the inspectors out in the field, assign them inspections and complaints, and also provide technical guidance when needed.
Okay. What led you to visit Brewed on November 24th, 2020?
We received a phone call from Karen Sanders, an inspector in the field, that she had encountered an issue out there regarding non-compliance with the emergency order as well as the masking order set forth by the government, Kentucky. And she called and asked for advice on how to proceed.
Did she ask you to come to the premises?
No, she did not. Luke, my supervisor, and I discussed it, and Karen had only been around on here for about 2 to 3 months at that point in time, and she was relatively new. And based on what we were hearing was taking place, Luke thought it would be wise for me to go out and evaluate the situation.
Okay. And I'm going to show you an image now, which I think was previously listed as Exhibit 3, or I'm sorry, Exhibit 5. I'm sharing my screen. Do you recognize this business?
I do. That's the Brewed Coffee Shop.
Is this how it appeared on the day that you visited?
Very much like that, yes.
Okay. And while I have it up, can you see where my cursor is moving
I
here?
can. It's the garage door.
Okay. So when you arrived at Brewed, did you happen to notice anything about the garage
When
door?
I first walked in, I glanced over at the garage door and noticed that it was up about approximately 9 inches from the floor.
So when you arrived on the premises, what did you observe?
When I first walked in, we were greeted by, I'd say at that point in time, somewhere around 7 to 10 patrons inside, and probably half of them were using their phones to take pictures and video us in the proceedings. I tried to ignore them for the most part, and I went in and went to talk to the front counter personnel, the employees, and met Mr. Cooperrider then, and was trying to conduct business. And there was a couple of folks in the crowd that were disruptive to some extent. They kept interjecting themselves into the conversation. But I was there to make sure Mr. Cooperrider understood that we didn't. What we wanted to do is just conclude business with him closing his indoor dining and conforming with the governor's order in regards to curbside delivery and takeout, which I thought a coffee shop would be ideal for.
You mentioned that there were customers inside. Were they wearing masks?
Some were, and there were some that weren't. I'd say probably at least 3 or 4 that were not.
Was anyone eating food or consuming drinks inside?
I didn't see anyone consuming food. I did see them drinking what I think was coffee.
And at this point in time, was the business allowed to be open for indoor dining?
No, it was not.
If it's true that there are exemptions for people that don't have to wear masks, who's responsible for enforcing that?
Objection. Calls for a legal conclusion. The order speaks for itself.
I mean, he's tasked with carrying out, these rules. I know that council intends to ask him if anybody had an objection and if anybody had an exemption and whether he asked them. I'm just covering that.
I'm gonna let him answer the question, as he is tasked with enforcement, and I don't believe the question is asking him to come to a legal conclusion. So as long as we avoid that, then it should be fine. So you can move forward, Mrs. Foster.
It was our understanding from the Kentucky Department of Public Health that it is the permit holders' responsibility to question their patrons in regards to mask wearing. And it's a simple question that if they say they're exempted, at this end of the conversation, they're exempted. But to elaborate on that a little bit, I presented the notice to correct for the masking, and at no time did Mr. Cooperrider indicate that anybody had been questioned or that there's anybody with any exemptions.
Did Mr. Cooperrider ever say to you that he was operating as a venue?
No, he did not.
Okay, I'm going to show you another document, if you'll just bear with me for one moment. Okay, can everyone see this document? Mr. Castleman, do you recognize this document?
I do. It's the notice of enforcement that I issued to Brewed facility, Mr. Cooperrider, for refusing to comply with the emergency order for indoor seating and dining.
And whose handwriting is on this document?
That's mine.
Did you explain this document to Mr. Cooperrider?
I explained it quite well. I tried to, I was making every attempt possible not to have to serve this document, trying to explain what he needed to, what he could do to keep from being closed. But he had made a point of saying he wasn't going to comply.
Did you ask him to sign the document?
I did. He refused to, saying that would indicate that he had done something wrong, I think, or words to that effect.
I now move to introduce this as Exhibit 6.
It's already,
Introduce this.
No, I did not. The one that I produced earlier was a notice of enforcement that had been issued by Karen Sanders.
okay.
This is the
Yes.
second notice that Mr. Castleman issued.
Okay. Any objection, Mr. Weist?
No.
All right.
What was the number again?
6.
So
I
number
believe.
7,
Oh, is it 7?
or yes, because the last notice of enforcement was 6.
Let's see here. So you provided him that notification. He said that he was not going to sign. What happened next?
I wrote refused to sign on the enforcement notice and told him that he was closed at that point in time.
And what did you do to go about closing the business?
I posted a closed sign on the door after I finished giving him the copies of the paperwork, which included the masking order and the emergency order for indoor dining, as well as copies of the previous documents that Karen had generated, the enforcement notice and the notice to correct for masking.
Okay. I am now going to play a video for you. Let's see. Let me get this open here. Sorry, it's lots of clicking going on here. Let's see. I don't see where it's shown up there. Let me try it this way. Is that showing on the screen?
The folder is that has several
Not
documents in a
the,
movie file.
but not the video itself.
It looks like you need to double click the video.
I did. It started playing on my
Oh, okay.
computer.
Make sure you click optimize video and put that little check mark in that box.
Right. This is the fun of doing stuff over the internet instead of in the real courtroom. Let's see, let me try it again. Maybe if I do VCL instead of. Okay, let me try to share my screen again. My apologies. Here we go. I think it's going to work. And I will. You asked me to also check the optimize for video clip box.
Correct.
Okay, let's see how this does. Is it showing now? Are you all able to see the video now?
Yeah, it looks like it's paused, but yeah.
Yes. Okay, good. I just wanted to make sure. Mr. Castleman, are you able to see this?
I am.
I'm going to play this just a second. Do you recognize the individuals that are on this video?
Yes, it's Karen and I right now.
Okay. Where is this video shot?
It's at the coffee bar at Brewed at the counter.
Okay. Do you remember the day when this occurred? Is this the same day that we're speaking about now?
Yes, there was. I've only been there once.
Okay. All right. I'm going to now play the video.
If you refuse, I'll have no reason to excuse but to close you.
Yep, I cannot make that decision.
All right, then you're closed.
Who are you speaking to at that moment?
There was a female employee at the counter. Mr. Cooper Ryder wasn't in my sight at that point in time.
Had you asked to speak to him and
I did,
to communicate?
yes. I did. I tried. I asked for him, and I can't remember what her answer was, but he wasn't available.
Okay, I'm going to continue to play the video.
Do you want me to write what they said?
And just because this is not being held in effect right now, at some point in time, the establishment will be held responsible for this.
We just heard the video there. Can you explain what you meant at that moment?
One moment. Let me, Ms. Domenico, I think you had a question. Are you asking if what was said in the video needs to be included in the record? Ms. Foster, do you plan on entering this as an exhibit?
Yes, ma'am, I do.
My feeling is that it does not need to be transcribed since it will be entered as an exhibit. So that's, I mean, I haven't formally had the motion yet, but that's the way I feel about it. So I don't think you need to. Either way, I'm sorry to interrupt, Ms. Foster. I just wanted to clear that up.
Okay. Mr. Castleman, can you please explain what you just said on the video?
Sure. I mean, we were closing the place, but they were in effect refusing to be closed. And what I was indicating was that they would have to be answered for in regards to the policy that they would have to follow is at requesting a reinstatement of their permit, which also would have entailed a conference where we would, I thought, would be able to air this out in terms of why they chose not to follow the rules that everybody else at that point in time and still has complied with.
Okay, I'm going to continue playing the video.
There will be a conference and a reinstatement inspection.
You'll be held responsible too.
We just heard a third party say you'll be held responsible too. Do you know who that person was?
I do not. He was throughout the time I was there, interjecting himself in the conversations that I was trying to have with the employees and Mr. Cooper Ryder.
So he was not an employee?
No, he was not.
Yeah.
And here's a copy of the masking order and the executive order for your indoor dining.
That's not legal.
Okay, we just heard another voice. I know I didn't do a great job of pausing this, but another party had just shown up in the distance. Do you know who that person was?
I do now. I didn't at the time because there was a lot of people talking, and I was focusing on the people in front of me, the employees. So I really wasn't listening to the background noise around me, or I was kind of ignoring it for the most part as much as I could. But after seeing the video, I did see that Mr. Cooper Ryder had come up and sat at the bar down at the end of the bar, so out of my periphery.
Okay.
Can't hear you through your mask. Can you speak up?
Have a good day.
Asking a
You
question.
need to ask for a hearing. Who's the owner?
Right? I said, if
You need to
right
ask for a
now-
hearing in
right
writing.
now, what I said is you
Ask
are
for a
closed
hearing.
And we
as
hear
far
a
as elected-
female voice saying, ask for a hearing. Was that your coworker, Ms. Sanders, saying that?
No, it was not. It was another one of the patrons that were in the lobby at the time. She yelled that out many times. And I'd already explained to Mr. Cooper and the employee what they needed to do in terms of getting reinstatement and requesting a conference to be reopened as far as the health department was concerned.
Okay. So does this video represent your only, well, I'll ask you that after we finish watching this. I'm going to continue to play this.
Not enough for a concern.
Okay, and I'm not gonna close, so what happens?
Excuse me 1 second. You need to ask for a hearing.
I
in
want a
writing.
hearing.
Yes, sir.
Sir, come back. Good question.
He's asking for a hearing.
I'm asking for a hearing.
You're a public servant. You need to identify yourself. Are you not going to talk? You're not going to answer this guy's questions?
Let
You're
me
not.
pause here. The person that had asked you that question, were they a employee or the business owner?
No, they were not. It was more of the patrons, the crowd. There was a lot of folks yelling things out. And at that point in time, I was being short because there was really no sense in carrying on the conversation. I had told them everything they needed to do, and staying and sticking around would just have created more of a disturbance in my mind.
In the years that you have done this job, is it a common occurrence that customers will get up and interfere while you're trying to inform the business about regulations?
It's the first time this has ever occurred to me in this setting. The only thing that came close to it before in my experience is when I was out late at night, I had to close a food truck for not having any running water. And there was people that outside the bar that weren't happy with me and about closing down the food truck. So that's the closest, but even that incident didn't come close to this one.
Okay, I'm going to continue to play the video.
I told you can request a reinstatement for his permit. That's all I've got to say.
This is an ex-veteran, folks. Forgot his oath. Works for the county health department.
He's never read the Constitution.
Doubt
I don't
it.
think he knows how.
The people that are speaking there at the end of the video, were those customers?
Though that was part of the crowd, the patrons that were inside Brewed and videotaping this. It's unfortunate that they stopped the video at that point in time, because it was only 20 seconds later that they were all confronting me at my vehicle, and Mr. Cooper was in my face yelling at me. The crowd, it was approximately 15 to 20 people gathered around my truck. And at that point in time, I thought we were going to have some issues.
Now, you had mentioned that you had gone in and served the notice of enforcement, and Mr. Cooper had said he didn't intend to close. And so you returned to your vehicle to get the paperwork for closing. Between those times, did the number of customers or people present change at the premises?
They did. There was about a 15-20 minute time frame where I had to wait for Karen to arrive with a close sign. We had, like I said, no intention of thinking we're gonna have to close this establishment, and we had to get some tape too, because it's nothing more embarrassing than not having tape to post a close sign and having to ask the establishment to borrow some. But during that time frame, I observed a good 5 or 6 cars come into the establishment with the folks in it. It's like a rally call that went out almost.
Okay. And you mentioned that there were other events that occur after that video ended. Can you describe what happened?
Sure. The crowd, again, they got around my vehicle. They started taking pictures of my license plate, and Mr. Cooper was at the head of the crowd, and where he had been rather demure before and not very outspoken. In front of the crowd, he became very outspoken and started yelling at me with profanity. And I saw no sense. I had already put my clipboard in, and I didn't see any sense in carrying on the conversation. So I got in my truck, and they moved out of the way. They didn't try to block me from leaving, and I left.
Did Brewed then close to in-person dining?
They did not, no.
What was the next step that occurred?
The next step that occurred was the Lexington County Health Department went up for a court action for cease and desist, I believe.
Did you testify in that matter?
I did.
And that was in Fayette Circuit Court?
Yes.
I move to introduce this certified record of the order that was issued in that matter.
I object. This record was vacated by order of the court, and because it was vacated, I think it's absolutely improper to introduce it.
Well, I think that final disposition of the case doesn't change the facts as they occurred, that it was necessary for the health department to take an additional step after this date to get Dean's Diner and Brewed to close to indoor dining.
I'm going to allow it under similar reasoning as the notice of enforcement or the other document before, where it's reflective of what happened at the time, but if I'm sure you'll be able to clarify what has happened since then. So I'm going to let it be admitted.
Thank you. Let's see. And I believe that's all the questions that I have for this witness at this time.
Sorry. Mr. Weiss, do you have any cross for this?
I do.
Thank you.
Mr. Castleman, this incident that happened in the parking lot that escalated all of a sudden, how long did that occur before you left? Like, I'm trying to get like a time frame of how many minutes that occurred or something like that.
Approximately a minute.
Okay.
Once that video ended, I to preface that.
Okay. How close were people? How close did they get to you?
Mr. Cooper Ryder was within 3 feet of me, in my face, yelling. The rest of the crowd, I'd say they were at least 4 to 6 feet away.
At one point in time during this interaction, were you playing catch with yourself in the parking lot with a baseball mitt?
I was. It was a nice day out, and while I was waiting for Karen, I was in the parking lot by my vehicle playing catch, yes.
Okay. Did you call the police over this alleged disturbance?
I did not, no.
So you did not feel threatened enough or that it was a disturbance enough to need to call the police, fair?
That's not quite accurate. My supervisor did call Lexington Police Department to respond. A Lexington Police Sergeant called me and asked me if I thought our lives were in danger. And I said no, and they said they would not be responding.
Okay. Did you have the chance to observe the ventilation within Brewed on the date in question?
I did not.
Do you know if anyone within the Brewed establishment had an active COVID diagnosis?
I do not.
I want to talk about your testimony about whose responsibility it was to determine that a mask exemption applies. I'm going to share an exhibit with you. I think this is the right one. You would agree with me that Executive Order 2020-586 is the applicable mask regulation on the date in question, fair?
That's fair, yes.
Okay. Go down, let's look. The governor defines, first he defines in paragraph 1 what a face covering is, right? See that right there? I'll just highlight it.
I see it.
Okay, is that fair? That first he defines what it is. right?
Correct.
And then he says, people must cover their nose and mouth with a face covering when they're in the following situations, right? And there's a whole list of situations, correct?
Yes.
And it says the following are exempt from wearing face coverings, and it's got a list of exemptions, correct?
Correct.
Where in there does it say that it's the restaurant's obligation or the facility's obligation to determine if somebody's exempt?
It doesn't say that. Apparently, if what was implied to us was that it's the permit holder or the owner's responsibility to ensure that the patrons entering their businesses have face coverings or state that they're exempt.
Were there any written orders issued by the Department of Public Health or otherwise available to the public that would reveal that?
Not that I'm aware of, no.
Okay. So you guys were enforcing an unwritten mandate essentially on businesses about what they were supposed to do to determine an exemption. Fair?
Objection. I mean, he's calling for a legal conclusion there, which he objected to earlier.
Which was overruled, so I think it's fair.
I'm going to allow him to answer that question.
If you want to, I don't see it as illegal. This was based on CDC guidance and most every other state in the union guidance that mask wearing was appropriate during that time, especially during that time frame when our COVID numbers were still quite high. So yes, we were enforcing it, and we weren't having any issues really enforcing it, except when with Brewed, to be honest.
So sir, I want to back up because again, we're looking at the exemptions here, right? On paragraph 4 exemptions. What you were enforcing, I think your testimony just was that that it was, well, originally it was the restaurant's or facility's obligation to determine if an exemption applied, right?
Correct.
Testimony. And I asked you, I said, where is that in writing anywhere to inform the general public that that's the requirement, that the facilities have an affirmative obligation to determine if there's an exemption that applies? And I think, you correct me if I'm wrong, your answer is it doesn't exist, correct?
It doesn't exist in this, obviously, but I was, think I was informed and that it's the permit holder, the owners, and I'm not even sure if it was publicized that the owners are responsible for policing their own businesses.
Where is that in this order?
I said I did. It's not there apparently.
Okay. All right. Was the video that we just saw accurate?
As far as I could tell, yes.
Okay. What prompted the all of a sudden minute-long alleged in-your-face interaction? Was there anything that prompted it between you and Mr. Cooper Ryder?
They, other than them following me out to my vehicle, no, I was getting ready to leave, so there wasn't anything prompted on our end.
And your testimony was that they allowed you to do that, correct?
That is correct.
I have another exhibit I'd like to show you concerning the court order. Were you aware that there was an agreed order of dismissal in this matter concerning your injunction?
Somewhat. To be honest, I lost interest in it when the judge entertained Brewed being classified as a venue.
Okay. The judge took up the argument about whether or not Brewed was an event venue? Is that what you said?
I don't know if he took up the argument, but he didn't disallow it.
Okay. And in this order, it indicates the temporary injunction previously entered against defendants is vacated, correct?
Yes.
You understood that to be the case, right?
Something to that effect, yes.
And Judge Travis signed that? Is that fair? Was Mr. Ames the counsel for the health department?
He was.
Okay. All right. 1 second, sir. You've not been back out to Brewed since the November interaction, is that fair?
That's correct.
Okay. After Judge Travis entered the order, did Brewed comply with it?
No, they did not. We had complaints sent in to us. There was, Brewed's own Facebook, I think, posted food trucks, and they were allowing people to come in, things like that.
Well, Brewed wasn't serving food inside in violation of Judge Travis's order, were they?
After the order, now you're talking about before the order or after we closed them, they were still serving coffee and everything. It wasn't until after the court order that they quit serving the coffee, but they did allow a food truck to operate outside their establishment and bring food inside.
You mean there was a food truck that was parked outside in the parking lot, and people were carrying food in?
It's right outside the establishment. I don't even think it was in the parking lot. It was right out on the road side, right outside the establishment.
Okay. And Judge Travis's order, if I recall correctly, prohibited Brewed from serving food, correct?
That is correct.
Was he himself serving food in violation of the judge's order?
Not that I'm aware of.
Are you aware that at some point ABC came in and issued an emergency order prohibiting further alcohol service within the establishment?
I'm aware of that, yes.
To your knowledge, was Brewed in any way, shape, or form non-compliant with that order?
Not that I know of.
Okay. And you acknowledge that the emergency order in question by the governor in November of 2020 did allow event spaces to have 25 persons, correct?
I believe that is correct, yes.
All right. That concludes my cross.
Ms. Foster, do you have any redirect?
I do. Just a very few questions. Now, we saw video of an encounter in the parking lot. Mr. Weist has asked you about the tossing of a baseball. So were there more than one interactions that happened in the parking lot over this series of events here?
Yes, I had a couple of, at least two patrons approach me while I was waiting for Karen. And one of them it seemed like it was trying to indoctrinate me in regards to the Constitution and asking my veteran status. And all I indicated to them is I'm doing my job. And another guy came up to talk to me about it and said relaying his veteran status and for the most part making conversation, but it didn't. None of them bothered me. They just were there out of the ordinary.
Mm-hmm. Was the tossing of the ball, was that happening while you were waiting for Karen to return with the tape?
It was, yes.
Okay. No, I know you've been asked about exemptions as to mask wearing. But during this time on the day that you visited, wasn't the business supposed to be closed to in-person dining?
Yes.
So even if everyone had an exemption, were they allowed to be in that space at that time?
No, they were not.
Okay. And did you make that clear to Mr. Cooperrider?
I made it clear that indoor dining was not allowed.
Okay.
Yes.
That's all the additional questions I have. I do want to take this opportunity, because I'm not certain I did this before, to move to introduce that video, because I forget if I did that previously.
You hadn't up until this point, Mr. Weist.
I object on the basis of completeness. I think that there's additional video that fully depicted the encounter, but I think ultimately we're going to end up introducing it. So at least at this point, I have an objection, but I have no objection once we get to it in our case. Does that make sense? I mean, I'm going to get to it.
I see what you're saying. I will let it be admitted because it's going to be part of a fuller video anyway. Whether I call it the complainant's exhibit or the respondent's exhibit, I'll make that call. For simplicity, I had numbered it as number 7. So we can put an asterisk by it or something to say that it's not the full video at this point.
Okay, and if I could, I'm sorry.
I'm sorry, could you clear up the exhibit that Mr. Weiss also introduced? I'm not sure that it was numbered.
He has not introduced, he's saying that he's going to during his case in chief.
No, there was a document he showed, I thought.
Oh, there was, yes.
I showed him the executive order, the mask order 2020. Let me get it. I think it's 586, but hold on, that's in my notes. It is 586.
Did you want to introduce that as well?
No, I think the cross was sufficient to deal with it.
Okay, yeah, I was going to leave that out. I didn't think it was necessary at this point. I believe.
If I may
Yes.
say one other thing about the video, and I don't want to belabor this, but the video that I played was played completely in what the department received. I did notice when I was playing it that it seems to have a lag there before it cuts off. And so we double checked it by downloading it again. And that, so if there is more information that comes after that, that was not provided to the department. And I just want to make that clear because I don't want it to seem as though we've cut the video in some way to end it earlier. That is the extent of the video that I received.
So there were 3 videos that were uploaded.
Yes.
Did you put them all together then? Is that what the video was?
No, I did not. I think it's called movie 1 in the compliance that you sent.
Okay. And that's my point, that those were all videos that were
movie
made the same day. So yeah.
Okay, well, but that would be a different objection because I just want to make clear that I didn't chop that video in any way. You know, just for clarity, for whatever that matters. But I don't have any further questions of this witness. However, because Mr. Weiss has said he does plan to play the videos and they do involve Mr. Castleman, I'd like to have him subject to recall in case that becomes necessary.
I object. I mean, you've gotten all the videos that we intend to play. If you want to deal with those with him, I think they need to be done now. If not, you know, I'm not going to.
I'm going to overrule that objection. I believe Mr. Castleman can be subject to recall. As far as the videos, I won't cover that quite yet, depending on what comes out. So, but she can recall Mr. Castleman. I do think, though, Ms. Foster, that since you did some redirect, Mr. Wiest has the, and I'm pretty sure I remember that it is Chris Wiest, right?
It is, yes.
Okay, I just want to make sure I had the pronunciation correct. So, Mr. Wiest, do you have a recross?
Yeah, just one final question for this witness. Sir, under you indicated nobody could be inside at this time, correct?
That is correct. Indoor dining.
Okay, so anyone that was inside that was not engaged actively in dining at that point in time was allowed to be indoors, correct?
I think that would go against the spirit of the emergency order. It's a food safety. They have a food permit to operate, so they're a restaurant, and so they shouldn't be inside unless they're picking up their order and leaving. So gathering was the in numbers was the reasoning that they shouldn't be there.
Okay, nothing further.
All right, Ms. Foster, anything beyond that?
No, ma'am.
All right. Then Mr. Castleman, you can leave right now. You are subject to recall potentially, but I'll have Ms. Foster or Mr. Newton contact you if that's the case.
Yes,
Right.
we'll call you. We will call you if it's necessary.
Thank you so much for being here. I do appreciate it.
Thanks.
Thank you.
Thank you.
All right, I'm going to bring Ms. Estes in. We're going to keep going. It looks like Mr. Newton, you're the one that's going to do the direct.
Yes, Ms. Stevens.
All right.
I'm sorry, Estes is coming in? Okay.
Mhm.
Yes, Laura Estes.
Just 1 second, please. Okay. Let me spotlight her on my end. Hold on. She's bouncing around.
Right. Mr. Castleman, do you mind muting yourself? Thank you. All right, Ms. Estes, if you'll raise your hand. Do you swear or affirm the testimony you're about to give is the whole truth and nothing but the truth? Yes. All right. Mr. Newton, your witness.
Okay, let me get one thing up real quick. I'm sorry. Okay. Hi, Ms. Estes, can you state your name for the record?
Yes, my name is Laura Estes.
And how are you employed?
I'm employed as an investigator with the Department of Alcoholic Beverage Control.
And how long have you been with the department?
2.5 years.
Okay. And I'm going to show you an image that has been, I believe, entered as Exhibit 5. Is that the building image?
Yes, that was the numbering so far. Yeah.
Okay. Let me get that real quick. That's not it. Yes. Oh, somehow. Okay. Can you see the image?
I see the Healthy at Work document.
Oh no, it's this one. Sorry. I will. Technical difficulties.
Okay.
Here we go. Now can you see the image?
I can see the outside view of Brewed on Malibu Drive.
Okay. And when did you become aware of Brewed?
I became aware of Brewed actually when it started its business, so maybe back in May of 2020.
Okay.
As far as this case goes, I was made aware of it on the 24th of November of 2020.
And how did you become aware of Brewed or what happened on the 24th for you to become
on the 24th? Another investigator was assigned to conduct surveillance, and I met him in the parking lot to go and check some other complaints. But shortly after, I was given the assignment over to take care of Brewed, as far as that being my assignment.
And what was the complaint against Brewed, or what did the complaint involve against Brewed?
The complaint itself came in on the 24th. That's why the other investigator was there conducting surveillance.
Mm-hmm.
It was about allowing indoor dining, mm-hmm. and what he was there to document. Mm-hmm. That's what I observed when I was there as well. They were allowing indoor dining.
Okay, and so you were present in the parking lot or at Brewed on the 24th?
Yes, sir.
And is this a fair and accurate representation of a fair and accurate representation of Brewed as you remember it being on that day?
Yes, sir.
Okay. Did you interact with anyone at Brewed that day?
No, sir. Just the other investigator.
Okay. When did you first interact with Brewed?
On the 25th. And that is when I delivered the emergency suspension order.
Okay. So when you arrived at the premises that day, what did you observe?
I observed a long line outside. If you're looking at this image, mm-hmm. right underneath the Brewed title, that's the front door. Mm-hmm. So if you look toward the right, there's a long line that was extending outside along the sidewalk. Mm-hmm. People trying to get into.
In which In which direction?
Going toward the right, so toward the other stores.
Can you see my cursor?
Yes, sir, that's the
Is
direction.
that direction? Okay. Was there anyone inside the premises?
Yes, sir. There were a lot of customers inside, seated, and some were in line. And like I said, the line started at the cash register and extended the door.
Okay. And the people who were seated inside, just to be clear, you became aware of them on the 24th as far as this complaint, and that had to do with what again?
That had to do with allowing indoor dining.
And who did that come from? Who made that complaint? Do you know?
That complaint in itself, actually, if you give me a second to just look at our Salesforce complaint.
Was it an individual that did it, or was it who was it?
Well, I was made aware of it from my administrators.
Uh-huh.
I'm looking at the complaint, and it does not have a complainant name.
Okay.
But when I met the other investigator there, that's when I noticed that the order to cease indoor operations and indoor dining, I noticed that they were allowing indoor dining on the 20th.
Okay. Well, and what do you know about that order to cease indoor dining?
Well, I know it was between the dates of November the 20th, and it was expired on December the 13th, so it was lifted on the 13th.
Are you aware of any other agencies' interaction with Brewed prior to the 25th?
Yes, sir. I'm aware of the health department's interaction with them.
And when was that? Do you know?
I discovered that on the 24th when I met up with the other investigator.
Okay, so to your knowledge, the Brewed had interacted with the health department on the 24th, and there had been a closure order.
Yes, sir.
And the closure order was, you said, I think, related to
not complying with the executive order.
And the executive order was for what?
It was for not allowing indoor consumption.
Okay.
Eating.
And were they allowing indoor consumption when you arrived?
Yes, sir. That's what I observed.
Okay. And how many people do you think were in the premises?
Oh gosh, there was a lot of people indoors. I did not do a head count. I did not enter the building. You could just see a lot of people through the windows, and you could see the line of people coming out the door.
Okay. And did you? Who did you meet when you were there?
Investigator Dean Casey.
I'm sorry, on the 25th. Who did you speak with when you were there?
Oh, on the 25th, I spoke with the owner, Andrew Cooperrider.
And to be clear, when you were talking about the indoor dining, you were talking that you experienced that was on the 25th?
Yes, sir. That was on the 25th.
Okay.
And so was the line going out the door.
The line going out the door, the people inside, that was all on the 25th?
Yes.
Okay. Who did you meet on the 25th?
The 25th, I met Andrew Cooperrider directly.
Okay. And what did you, what was your interaction with Mr. Cooperrider?
My interaction with him, the purpose of my visit was to hand deliver the emergency suspension order, the notice of violation, and to have him sign my proof of service that was there. And so when I went through the front door, I identified him immediately. He was really close to the front door greeting his customers.
Was he wearing a mask?
He was, yes.
I'm sorry. Could you try not to talk over top of each other because I missed it a little bit.
Oh, yes, ma'am.
I just want to make sure the reporter got it. The question was he was wearing a mask, and the answer was yes, right?
Right,
Yes,
that's what I asked. Let's see. Did you say anything to Mr. Cooperrider about his remaining open?
What I said to Mr. Cooperrider as I handed him the folder of those documents, the emergency suspension order, the notice of violation, and the healthy at work document, and the state of emergency that had been issued on the 18th, or effective on the 20th. I introduced myself to him, told him my nature, my visit was to give him the emergency suspension order And what that meant was he could not sell alcoholic beverages until the resolution of the emergency suspension order. I also read, he wanted to read the order of service, the report of service before he signed it. And so I allowed him to read it. As I read it to him, he could read along with me, and he agreed to sign it. And I showed him on the notice of violation how to get in touch with ABC's general counsel, Joshua Newton. And I also just said, you might want to share these documents with your attorney and have them talk with Mr. Newton.
And did you do anything further on the premises that day?
No, sir. It was a real brief, go in, give him the documents, get the signature, tell him what I needed to tell him as far as ceasing his alcohol sales, and to make sure that they were just locked up where the public couldn't access them. And then I was out the door. I wasn't in there very long at all.
Understood. So then, do you know whether he complied with the ABC order?
As far as no alcohol sales, he did comply. The very next day I went to check, and he had already put some partitions in front of his alcohol coolers and had them locked where it wasn't accessible to the public.
Okay, and did you witness any other, what did you witness that day?
Okay.
Was he still allowing on-site
There were
service?
still customers, yes, in his business. And what I documented that is he was complying with the alcohol portion of the emergency suspension order. However, customers were still allowed in the business.
And when they were allowed in the business, were they also eating or drinking while they were in there?
Yes.
Okay. So that was the next day. Did you follow up any further?
I did. There were multiple dates that I conducted surveillance just to document the dates that he was open and allowing people in.
Okay. And how long did you continue to surveil the?
I conducted surveillance between the dates of right after the 25th through December the 21st.
And did he continue to?
Sorry.
Did he continue to allow on-site dining for that period of time?
Yes.
Okay. At any point, do you recall him stopping?
No, I don't. There was one date, December the 7th, that had a food truck outside with a trailer and tables set up, but the other days I did not observe any food trucks that were there.
Was there any other sort of monitoring of? Did you conduct any other sort of monitoring of Brewed after December 15th?
I did. I did some social media searches and observations after that.
And what did you find on those?
What I found on the Facebook posts was still pictures from inside, people consuming, him advertising events and offering food.
Okay. Gonna show you another picture of stuff. I'm sorry, I had left that picture of the premises up the whole time. I didn't realize. Let's see. I'm gonna share another image with you. Have you seen this image before?
I have seen that picture before, yes.
And what is it a depiction of?
This picture was posted on Brewed's Facebook page on April the 17th of 2021.
Mm-hmm.
And what I observed when I see this picture is no one wearing masks, no one in line. There's not social distancing going on as far as the people that are moving about the premises. I can see an employee behind the counter that does not have a mask on. And it appears from the other times that I've been in there that maybe another couple of tables have been added to increase seating capacity.
And to your understanding, in April 2020, on April 17th, what were the requirements of the food?
Just the healthy at work requirements were still facial coverings when moving about the business or the premises. Social distancing was still a requirement, so a social distance. Employees needed to wear masks. And at this time also, what I see is a bar service, so people going up to the bar and ordering instead of being seated and having their order taken from the table and brought back to the table.
And there's also a capacity requirement, right?
Yes, there is a capacity requirement. I believe, I want to say it was like 66%. And I don't know what his overall capacity is.
Mm-hmm.
This just looks very busy.
Okay. And so
I'm going to object to all of this. And here's the basics. The charging documents in this case reflect a particular period of time. Mr. Newton is now apparently attempting to ambush us with additional charges 6 months after the fact. And I think it's wholly improper on the basis of process, fair notice, the charging documents, and everything else.
I have not claimed, nor do I plan to lodge additional charges or violations that he will have to answer for these.
I do see Mr. Weist's point in that, from what I understand, the violations are all from 2020.
Well, my understanding of what has happened here is that these are continuing violations, not new violations.
Okay. I will let you finish your direct of Ms. Estes, but I'm not sure of whether I'm going to, I mean, you haven't formally introduced this particular photograph, but if it's outside the realm of the violation period, then I'm not going to admit it into the record.
So on the 25th of November, when you went to the premises, what did you observe on that day? Just
on that day is when I observed the line of people coming out of the front door, right down the sidewalk, and multiple people inside the business.
And you said, sorry?
And not social distancing, and some were not wearing masks, some were.
I may have spoken over you at the beginning. What did you say at the beginning of that?
Oh, I'm sorry. What I observed was a line of people coming out of the front door, waiting to get in, the line to get in. There was a lot of people inside the building. Some had masks on, some did not. There was some people not social distancing.
Okay. And was anyone eating inside?
Yes.
Okay. Were these things that you mentioned, were these all violations?
Yes.
Okay. I don't have any further questions.
Okay, let me. All right. Ms. Estes, Mr. Weist is going to ask you some cross-examination.
Ma'am, we're here today in ABC and yourself are enforcing restrictions related to the state of emergency. Is that fair?
That is what I'm here for, yes.
Yeah, and ultimately that is going to impact the ability of Brewed to remain fully operational for in-person services. Fair?
I understand that.
Okay. Do you know today, as we sit here today, whether or not Brewed is in compliance with guidelines issued by the Centers for Disease Control?
I do not.
Okay. By the way, a long line outside of business, people were going to be taking, picking stuff up for takeout. That in and of itself would not be a violation of the governor's orders, right?
Exactly.
Okay. Did you observe on the 25th anyone consuming alcohol?
I did
within
not
the
look for
premises?
anyone consuming alcohol because at that time, before he was given his emergency suspension order,
Okay.
they could have ordered alcohol.
Do you know whether or not your co-inspector observed anyone ordering or serving alcohol related to the issues on the 24th of November?
I cannot speak to his behalf.
Okay. And I think your testimony was that once he was issued the emergency suspension order, he complied with that insofar as serving alcohol.
Yes, sir.
Fair?
Yes.
Okay. I know we kind of got into the testimony, so I just want to be clear. You're aware the legislature passed several bills related to the governor's emergency powers and COVID-19 restrictions, correct?
Yes.
And those bills are the subject of litigation, and I think 3 circuit courts and the Kentucky Supreme Court currently, right? If you know. If you don't, that's okay.
I don't.
Okay.
I don't know the outcomes of them.
Okay. Do you know what the do you know what the capacity is for Brewed? What the building occupancy is?
I do not.
Okay. And obviously, you yourself did not measure tables on social media or anything else, did you? You weren't able to measure distances or anything like that, correct?
Correct.
Okay. All right. I think that concludes my cross.
Mr. Newton, do you have any redirect?
No, I do not.
All right. Ms. Estes, thank you so much for being here. Mr. Newton, did you plan on calling Ms. Estes potentially for rebuttal?
I don't believe so, no.
All right, then you are excused. Thank you very much for being here, Ms. Estes.
Okay, thank you.
Thank you. All right, and Mr. Newton, that, as far as I can tell, was your last witness. Is that correct?
Yes.
All right,
Yes,
Mr. I think you were waiving just so that you could potentially say your opening statement at this part. Is that correct?
I am, and I will be fairly brief. With all due respect, we are here today for really one reason and one reason alone, and that is that Mr. Cooperrider has engaged in protected First Amendment speech that's been critical of the governor of Kentucky, which has justified really a troubling attempt to go after him. And I think what's interesting as we sit here today, and I think we're going to talk about it, is that here the ABC is enforcing, quote unquote, enforcing the law while itself acting in raw defiance of legislative enactments under which it is subject. We will be introducing today the 2021 House Bill 1. House Bill 1 requires the preparation.
Object to this. It is irrelevant to this case because it's current. It is currently. It is. If you wanted to have this introduced, you could have filed a dispositive motion. You did not. That statute, that bill, is not retroactive. There is no relevance to that statute.
At this point, it's his opening statement. So if he can renew your objection if he introduces it later. But I'm going to let him finish his statement.
So thank you. House Bill 1 was passed over the governor's veto on February 2nd, 2021. And it deals with, it says, Section 1, notwithstanding any state law, administrative regulation, executive order, or executive directive to the contrary, during the current state of emergency declared by the governor in response to COVID-19 or any future state of emergency related to any virus or disease, included but not limited to any mutated strain of the current COVID-19 virus until January 31st, 2022. And that bill indicates businesses are entitled to adopt a plan. And if they do adopt a plan, The bill indicates they may remain open and fully operational for in-person services. The other section of that bill says no state or local agency shall enforce restrictions related to the state of emergency impacting the ability of entities listed in this subsection to remain open and fully operational for in-person services that exceed current applicable guidelines issued by the Centers for Disease Control and Prevention or the executive branch, whichever is least restrictive. We're here today, and they are enforcing restrictions related to the state of emergency impacting the ability of Brew to remain open, which the ABC inspector admitted. And she doesn't know whether or not he is in compliance with current applicable guidelines, but the testimony that he's going to submit is that he is. And as a consequence of that, this entire prosecution is illegal by operation of the emergency clause in that bill, which made it take emergency immediate effect. Now, I understand that bill and its validity is being litigated, in fact, in several different forums, including the Kentucky Supreme Court. But I disagree with any contention that the bill is not retroactive. It prevents current enforcement, any current enforcement, whether or not it's enforcement before or enforcement after. There's no limitation on it. It says no local agency shall enforce restrictions related to the state of emergency. So here we are, and we've got a government agency enforcing its rules and defying other legislative enactments passed by the people's representatives. The irony is not lost on me, and I don't think it's going to be ultimately lost on a circuit court reviewing this matter. So the proof is going to be, one, that he is in compliance with House Bill 1. The proof is also going to be that on the date in question, there was an open legal question about whether or not he had to go and shut down, and that was litigated in the circuit court for indoor dining. And upon a court order, the fact of the matter is that Mr. Cooperrider complied with the terms of the court order, ultimately resulting in that court order being vacated for mootness. So as I look at this, I see perhaps a technical violation, but here they are trying to revoke entire liquor licenses contrary to Kentucky law, and that will be my proof today. Thank you.
Thank you, Mr. Wiest. Mr. Cooperrider is your first witness, correct?
Yes.
All right, Mr. Cooperrider, if you could unmute and then I'll swear you in. Sir, do you swear affirm the testimony you're about to give us the whole truth and nothing but the truth?
I do.
Okay, your witness.
I'm sorry. Can I ask one thing? I hate to interject, but does Mr. Cooperrider have somebody present in the room with him? I would need to note for the appearance page.
I am in my office. There's some people coming in and out throughout, but nobody outside of people who are already disclosed to be on the call.
Okay, I just need to make that note.
All right. Sir, can you state your name for the record?
Andrew Cooperrider.
And are you the owner of Dean's Diner, limited liability company, doing business as Brewed?
I am.
And you've been the owner of that business throughout the pendency of this dispute with ABC and other government agencies, fair?
Yes, I've been the owner for over a year.
Okay. I want to go back to the November 24th interaction with the health department. When they came in, before they came in, did you believe that you were in compliance with the governor's orders?
Yes, I did.
And why is that?
Because the requirement was to be in a heated patio. I looked up the definition of what a heated patio is. It is a concrete floor with a overhead, a covered concrete area with open to the air is how it was defined in the dictionary. Therefore, I believe that by opening up that garage door, I was opening my building up to the air, and my floors are polished concrete, and I have a roof. So I reached the Webster's dictionary definition of it.
Were you also operating at that time as an event space?
Yes, we constantly have events at Brewed.
Like what?
Mixed events. I mean, obviously, we have a lot of political events. We also have live music. We also have events where we're closed to the public. Many times we've had art markets out there. We've done a good amount of events over its existence.
You've heard the health department testify today to representatives about their interactions with you on the 24th. What was your recollection of those interactions on the 24th from your perspective?
I mean, my recollections is that they came in to close us. I brought up my point about patio, and then I mentioned, I would like to talk with counsel. They attempted to have me sign things and close. I kept repeating, I'm going to talk with counsel about the issue. And, there was some discussion over variety of issues, whether or not how they would enforce things like that. I remember there was one point where Skip had said he was calling the police to come close me, and then he had came back in and said they weren't enforcing. And I really want to know what happens if I keep operating. He couldn't provide me that answer, and so I needed to seek advice of counsel before I could make any decisions.
Okay. Your recollection was that you wanted to talk to legal counsel before making determinations?
I believe, yeah. Well, I know so, and I believe if you remember the testimony of both Skip and Karen, they had mentioned that I need to talk to my attorney, and I'd said that to them several times.
Did you ever yell at Skip?
Not as I would define yelling. I guess if he wants to define that way, I mean, I was pretty far apart from him. I mean, there was one point, where I brought up the fact that he wasn't wearing his mask. If you remember that video, he took his mask off. And there's one point where I mentioned that I was wearing a mask and he wasn't when we were outside. And he said, well, that is because we're 6 feet apart. So, we're outside. We're pretty far apart from each other discussing. But, I personally, I wouldn't define it as yelling. But, I grew up in a, maybe a different family than he did that has different definitions of yelling.
Did you ever swear at him?
Not that I can recall, no.
Let me ask Mr. Cooper Ryder. ABC came in on the next day, did they not, with an emergency order?
I believe so, yes.
And what did you do in response to that ABC order?
Well, he served it to me. She explained it, unlike the health department, which is why I signed it. And then at that point, as soon as she served me with those papers, I turned my beer fridges around. I locked them in place so they couldn't be turned back around. So I locked and secured my alcohol, and I ceased selling alcohol from that point forward until I was given reinstatement impending of this hearing.
There was some litigation in the Fayette Circuit Court over the health department orders. You remember that?
I remember parts of it. Yeah.
Okay. I'm gonna show you. Maybe. There we go. How? By the way, what was your argument in connection with that case?
Well, after I had said I wanted to talk with the attorney, I just reached out to counsel, and we discussed it, and they said, there could be a way that if you're operating as an event venue, because you've done events in the past, that you can continue to operate as an event venue. And that was the legal argument on that day.
Okay. And I understand that there was a temporary injunction that the judge issued, fair?
Yes.
That temporary injunction, do you remember what that prevented?
It prevented us from preparing and serving food.
And did you comply with that?
We did comply with that.
Okay. Ultimately, the resolution, and what I'm showing you is exhibit, I guess what we'll mark as, and I apologize for the hearing officer's purposes. What exhibit are we up to in this matter? Just for my purposes.
I think this is 8.
Exhibit 8. Exhibit 8, the December 17, 2020 order by Judge Travis vacating the temporary injunction.
Yes.
And you've seen this before because you're a party to the case.
Yes, I believe I signed it at some point.
Okay. All right. And it was dismissed with prejudice, fair?
Mm-hmm. Yes.
And you reached an agreement with the health department, fair?
Yes.
And until the law changed, you, which was an eventuality in the health department agreement, you complied as well, fair?
Yes.
Are you familiar with 2021 regular session House Bill 1?
I am.
And is a copy of it at Exhibit 5? I'm sorry, is a copy of it, am I showing you? I guess we're up to Exhibit 9.
Yes, that is the first page of it.
Okay. The rest of it follows?
Yes.
Did you create a plan in accordance with House Bill 1?
I did with the advice of counsel.
Okay, and am I showing you that? I'm marking as Exhibit 10. Is that what we see here at Exhibit 10?
Yes.
Okay. And did you post it on your door of the facility as well as House Bill 1 requires?
Yes, it's, I believe, still there today.
And that's at Exhibit 11 here?
Yes.
Okay. Your knowledge, have you complied with that plan?
Yes.
And are you familiar with the CDC guidance for restaurants and bars?
I am familiar. I keep up with it. They sometimes lag behind. I know that, for an example, 3 weeks ago, they changed their CDC came out with different guidance on touch surfaces, though the CDC hasn't changed its guidance yet for restaurants, but I am familiar with it.
To your knowledge, is your facility in compliance with the CDC guidance for restaurants and bars?
Yes.
Right. I'm going to go back to your interaction with, I think it was the first health department inspector. Can you tell me what happened with that on the 24th of November?
Yeah. Karen, as I recollect, Karen came in. She'd walked up and she had said that she was with the health department. She is there to do an inspection, but said I had people indoor dining and they would have to leave. At that point, my garage door was open, but it wasn't open, fully open. So I did offer to her to fully open my garage door if that would be acceptable to her, so I could continue to operate with as a heated patio space. And she replied that 50% of the walls would have to be missing. At which point, knowing my business, knowing my financial situation, I think is evidence based on the amount of coffee shops that have closed, that we weren't going to survive if people were not able to sit down, use our Wi-Fi in a comfortable setting and drink coffee. And so I knew that closing would mean the closing of my business, to close the patio area there that I believed I had. And I told her, I need to talk to my attorney before I need to comply or sign with anything.
Okay. Were people recording her?
Yeah. I mean, we have cameras in our building too. I don't think they save back that far. But there were people who were recording her, sure.
How many people were in there at that point in time?
At that point in time, we had a gathering of 4 people in one corner and a Bible study going on in the back corner of about 4 people.
And anyone else?
Just myself, and I think my wife was there working the counter with me.
Okay. And then later, Skip Castleman came?
Well, Karen left, and then she came back in. People were recording, and she was obviously a little nervous, and she had requested to be able to speak in private. So I was like, yeah, sure, we can come back into the kitchen, and take a look around. It's funny, actually. I remember my wife was upset she didn't do her inspection because she had cleaned extra well the night before, and was very excited to have that inspection at that time. But we had allowed her back into the kitchen to discuss things so she could feel more comfortable. And that's where she discussed, once again, wanted me to sign. I haven't been able to contact counsel. And I told her, I can't be complying. I need to figure out what's going on here. And that's when she left and said she would be calling her supervisor, I believe, at that point. And that's when she called Skip out there to move forward.
Okay. And so at some point thereafter, Skip showed up?
Yes, Skip showed up at some point.
How much longer after Karen left?
I think it took about 30, 45 minutes.
And by the way, this was in the middle of the day.
She came in at about 9 a.m. ish, 10 a.m. ish, I believe. It was earlier in the morning.
And when Skip showed up, what happened then?
He showed up. He repeated the same thing she did, and I repeated that. I need to seek advice of counsel. I need to speak with them before I close my business and lose my business and figure out what to do here. And he said that, all right, I'm going to go call the police to close you. And then he went out into the parking lot. He proceeded to pull out a ball and glove and play catch with himself as he, in his mind, is waiting on the police to come shut down a small business. And then he came back in with Karen and said, as the video they played earlier, he came up and he said, well, you're closed. And I believe he said something about he was surprised the police wouldn't be enforcing it. And so which led me to ask, so the police won't be enforcing it, where I came up there because I was standing off to the side and I was like, so the police won't be enforcing it. And he wouldn't answer my questions. As you see from the video, I was asking him several questions as a business owner. I want to know what happens next, what to expect, so on and so forth. And he just started walking away. And somebody there had said, hey, he needs to acknowledge that you asked for a hearing. And he didn't acknowledge me stating anything. At one point, he actually turned, as you saw in the video, and said, I'm not going to be answering any more questions, which, of course, you're a business owner just trying to survive. You need some answers. And so we kind of followed him out into his parking lot. Nobody, as they said, blocked him in or anything else. And, we had a discussion about what happens, what actually happens if we continue to serve. And he couldn't answer that question. At no point did anybody come close to him. As I stated, Skip himself had stated that we were over 6 feet apart. In prior hearings, Skip has also stated that he'd decided not to call the police because he didn't feel threatened. And so we got out of his way once he got into his truck and he left right away. At no point did we block anybody in. I mean, as Karen said, the minute she asked somebody to move, we moved. It was definitely not a disorderly crowd, to say the least. And then from there, people started showing up to support us, and we continued to operate. And I talked to council, and we talked about the event venue. And so we continued to operate under the auspices that we were an event venue.
And you believe that there was a legal argument that would allow you to operate as an event venue?
Not only do I believe so, but it seemed to have also tripped up Judge Travis in that hearing too as well. He was very confused. If you remember from Skip's testimony, he had stated that he stopped paying attention when the judge actually started to entertain the idea that we were an event venue.
Did you believe that the governor's executive orders were confusing?
I mean, they're not just confusing, they don't make a lot of sense. I mean, for an example, there's a one point during this order where I went to a movie theater and they could serve you popcorn and wrap snacks, but they had stated that they believe the orders made it to where they were not able to, for an example, put hot dogs on a roller and serve you a roller, which, I don't know what COVID has to do with whether or not you cook a hot dog, but they were able to serve items to eat in the movie theater, but they just couldn't cook them. That was the line. And I don't see what that has to do with COVID. I thought eating was the issue, but the order allowed eating, and it allowed eating at event venues. So it was certainly very confusing. It seems like one person's writing these without much input from anybody else that actually works in the industry.
1 second. Before I wrap, I would move to admit exhibits 8 through 11 that I just introduced with the witness.
Mr. Dearson?
Eight, and if you could remind me, 8 is the. Could you restate?
Yeah, let me go back. We'll go look. Hold on. I know I marked them for identification
I
Mm-hmm.
purposes.
have injunction for number 8, the business plan for number 9,
Yeah, 8 I thought was the agreed order of dismissal.
Okay. Maybe that's how my numbering got messed up. So the injunction is number 9, and then the plan is number 10.
No, number 9 should be House Bill 1, I believe.
So I believe you were right that 8 was the injunction, and so 9 would be the agreed order of dismissal, and then but
I'm off a number then.
Okay. Well, why don't we, I mean, this can be clarified with the transcript or whatever.
Right. I think for the record purposes, I'm moving to admit number 9, the agreed order of dismissal, number 10, House Bill 1, number 11, which speaks for itself. Number 11 is the House Bill 1 plan, and number 12, also the House Bill 1 plan, but posted on the door as required by the regulation.
I believe I would be. My only objection is to the entry of the House Bill 1.
I'm going to overrule that. I'm going to admit all the evidence that's been used during Mr. Cooper Ryder's testimony. Mr. Weiss, do you have any further questions of Mr. Cooper Ryder?
I do not. Let me stop sharing.
Okay. Well, then, Mr. Newton, you're free to cross, and just so everyone's aware, Ms. Rutherford is now in the waiting room.
Okay. Hi, Mr. Cooper Ryder. I just have one question. On November 24th, were you open for in-store dining or consumption?
My heated patio, as I understood it, was open.
By heated patio, I'm sorry, do you mean the interior of your premises?
That's what you want to call it. I believe it's a heated patio.
Okay, nothing further.
Okay. Mr. Weiss, do you have any redirect?
Do not.
All right. Well, then I guess we're ready for Ms. Rutherford to be admitted. It's now 2:03. Does anybody need a quick break?
Can I run to the restroom real quick? It'll just take 3 minutes.
All right. Well, why don't we just take a short break, and as soon as you're back, we'll get started. I'm going to let Ms. Rutherford in right now.
Okay, I'm going to just go off the record real briefly, and the time is 2:03 p.m. Sorry, I'll be real quick.
Ms. Rutherford, you have not been present so far. My name is Eden Davis Stevens. I'm the hearing officer that's been assigned to hear this matter. I know you're one of the witnesses for the respondent, and so Mr. Weiss has called you here today. We're taking a brief break, but once the court reporter is back, we'll get started with your testimony.
Okay, thank you.
Yes, all right. And just so you know, like Mr. Weiss will be the first person to ask you questions, and then there may be additional questions. I believe it'll be Mr. Newton that will have them. But as soon as we come back, you can mute yourself for now, and then when we get started on the record, I'll ask you to unmute.
Thank you. My bladder thanks you.
I understand.
Okay.
We can go back on record now. Ms. Rutherford's present.
Okay, Stan. What is her name? Molly?
Dr. Mary Rutherford, I go by Molly.
Okay. Mary. Okay, stand by, please. I'm back on the record. The time is 2:05 p.m.
All right, Dr. Rutherford, if you could raise your hand. Do you swear affirm the testimony you're about to give is the whole truth and nothing but the truth?
I do.
All right, Mr. Weiss, you're a witness.
Afternoon, Dr. Rutherford. Can you state your name for the record?
Dr. Mary Rutherford. I go by Molly. Molly Rutherford.
Doctor, do you have a medical license here in the Commonwealth of Kentucky?
Yes.
Where did you get your medical degree at?
From Eastern Virginia Medical School.
In what year?
2003.
What was your undergraduate? I'm sorry, you have a master's degree as well, do you not?
I do.
In what?
Master's in Public Health. Master's in Public Health from Johns Hopkins University.
And do you have any experience in public health?
Yes, prior to medical school, I worked for the National Institute of Allergy and Infectious Disease as a policy analyst. And I have since then stayed somewhat involved in public health. I was a rural physician for 5 years and received grant money from the National Health Services Corps to help in an underserved area. I was a member of the Healthy Oldham County Coalition here in Oldham County to help obtain funding the Drug-Free Communities Act for the Drug-Free Communities Act. And I've been active in advocacy around addiction for many years. I participated in a HHS committee from 2018 to 2019 called the Pain Management Best Practices Task Force. So I think that was everything.
Who did you work for at the National Institute of Health?
I worked for the National Institute of Allergy and Infectious Disease.
Okay.
So the director of that institute is Dr. Fauci.
And you worked for him when?
I worked for the institute for 6 years, from 1993 to 1999, and from 96 to 99, I worked down the hall with him directly for the Office of Policy Analysis at the Office of the Director.
What kinds of things would you do in that capacity?
I prepared his remarks to the council, the NIAID council, 3 or 4 times a year. I don't remember exactly how many times a year. And our office prepared him for any media appearances he might have, or for some meetings with representatives on Capitol Hill, and or with the president at the time.
Okay. Where do you have what states do you have medical licenses in?
Kentucky and Indiana.
Okay. And how long have you had a Kentucky medical license?
Since 2006.
Okay. And what is your area of practice?
I'm a primary care, so family medicine, and also board specialized in addiction medicine as well.
Okay, so would it be fair to say that you're a general practitioner?
Yes.
Okay. What's been your involvement with, by the way, what is are you familiar with the Kentucky Academy of Family Physicians?
Yes.
And what is that?
It's the Kentucky chapter of the American Association of Family Physicians. So it's most family physicians belong to the AAFP, and the KAFP is the Kentucky chapter.
Okay. And what have you had any leadership roles in connection with that?
I'm on the board now. I was president in 2000. I was president from September of 2018 to September of 2019, I believe. I got those dates right. And then board chair from until 2020. So most of that time I spent advocating for physicians to do direct primary care and also treat addiction.
Okay. Have you, in the course of your practice, dealt with any public health issues?
Well, as a primary care doc, we always do deal with indirectly with public health issues. The main one that got me into the field of addiction was moving to Kentucky actually in 2006 when I became very aware that we had a problem with an opioid epidemic. I trained in Virginia. We didn't really have what I would call a prescription pill problem in Virginia at that time. So it was kind of a shock to me when I learned of the problem that we have here. So that was the first public health issue that I became involved in. And that was one of the things that drew me to the Kentucky Academy of Family Physicians, because I felt that too many people were, too many doctors in our state and other providers were overprescribing those medicines.
I guess I'm going to back up. You did complete a residency in family medicine?
Yes, in Portsmouth, Virginia.
And what year did you complete the residency?
2006.
Okay. Have you participated in any publications or research?
Yes, recently I was involved in a publication regarding the treatment of COVID-19, early outpatient treatment of COVID-19. And when I worked at the NIH, my name was on a couple of publications, but my maiden name was Hardison at the time.
Okay, and have all those publications been peer reviewed?
Yes.
Okay. The one you did on COVID-19 treatment, was that an international publication where you worked with doctors across the world to publish?
Yes.
Okay. Have you actually had the opportunity to treat COVID-19 patients?
Yes.
And how many of those patients have you had the opportunity to treat?
A total hundreds in my own practice in person, people that belong to my practice, for example, probably less than 100, but I participate in telemedicine to help people who have COVID.
Would it be fair to say that you understand how the disease spreads?
Yes.
Has the understanding of how the disease spreads evolved over time?
Yes.
And have you tracked the emerging literature on COVID-19?
Yes. I also had COVID-19.
You also had your personal experience.
Yeah.
Okay. I would ask the hearing officer, I'd like to proffer the expert in question in medicine and public health.
Mr. Newton, do you have?
Yeah, I object. I don't think she's that he has laid the groundwork or foundation for any expert testimony on public health administration regarding a pandemic.
Mr. Wiest?
She worked for the National Institute of Health. She worked right for Dr. Fauci. She's got a master's in public health.
My understanding was that she worked for him in the late 90s.
I am unaware of any shelf life that exists for expert testimony. She has continued to review research. She has the credentials. She has the experience, education, and training. We admitted as an expert tentatively someone who has none of these qualifications about 2 hours ago. So she meets every qualification to be an expert in these areas.
I love the testimony, but I haven't made the call on that witness as far as whether or not she's an expert. But I think, but especially with the weightiness of that determination, I will treat it similarly, and I'll just take it under submission before I make that type of determination. But of course, I will also allow your directive, of Dr. Rutherford, to continue. So you can continue.
Doctor, what is your understanding about COVID-19 and aerosols?
Originally, we thought that the virus was spread primarily through large droplets. And then with time, it became clear that it was spreading primarily as an aerosol. So as a tiny virus particle carried on like an airborne particle that remains in the air for several minutes, if not days.
Does that affect how the virus spreads?
Yes, it makes it a lot harder to manage in terms of, I guess originally we thought probably masks would help, or distance between people would help keep spread from happening. And now that we know it's airborne, it's clear that those measures won't really be very effective.
Okay. Do you have an opinion about whether or not it was necessary to shut down restaurants to help spread or help stop the spread of COVID?
At the beginning, I supported what happened in terms of trying to flatten the curve. So my understanding originally was that things were going to be paused and closed temporarily in order to not overwhelm hospital systems. My issue with the ongoing closure and then the restrictions on how many people were allowed in a restaurant and all of the other restrictions was it became very clear in April and May, when many hospitals were sitting empty, that we did not have a situation in Kentucky where we were overwhelming the hospitals. And prior to, I think, 2019, the CDC and the WHO all made the statement that in free societies, the damages from trying to close schools and close businesses and so forth would outweigh any potential for benefit from for the pandemic.
Do you have an opinion whether or not a restaurant remaining open in violation of the governor's orders in November of 2020 would endanger the public health?
I don't believe so, based on what I have seen in terms of the percentage of spread that happens in restaurants. By November, we knew that I think 80% of spread was happening in households, and much of the spread was also happening in hospitals and long-term care centers. So by that time, we really knew that this virus was not. That restaurants were not a big source of outbreaks for this virus.
And are there secondary effects to shutting down, say, a restaurant for indoor dining and restaurants going out of business? Are there secondary public health effects from that?
Yes, absolutely. We've seen unemployment at one point. 1/3 of our state was declared unemployed, and people who are unemployed are at higher risk of death. We know that from just economic data, and it led to I saw personally relapse among people with addiction. I know of 4 people who died as a result of relapse on opioids and overdose, one of whom was my cousin. He doesn't live in Kentucky, but he actually died, unfortunately, when he was waiting for admission to a facility because of a COVID test. So they weren't going to accept him to this facility until he tested negative for COVID. So he died of an overdose in December. So those are some of the consequences. People just lose purpose. They become anxious. They become depressed. Being told you're non-essential there are articles and studies about how that can be damaging to one's psychology. So there's all kinds of public health implications.
And are there peer-reviewed studies that back up the opinions that you've rendered here today?
Yes, many of them can be found on collateralglobal.org. They're collecting all of the studies. The ones regarding the school closures and what's happening with the kids are probably the most heartbreaking in terms of that damage. But I definitely know of some businesses who were dramatically affected by this. One of my patients, one of his businesses is completely gone, and I know of a restaurant here in LaGrange that had to close, and she's operating out of a food truck now. So I know of many people who have really suffered. I'm a small business owner myself. I just happen to be lucky because I'm in healthcare, And so it really did not affect me negatively, but I've seen it throughout my community, and I think everyone knows logically that it's happening.
The opinions that you've rendered today, are they rendered to a reasonable degree of medical and public health certainty?
Yes.
I believe that concludes the testimony that I have from Dr. Rutherford. I tender the witness.
Thank you, Mr. Newton. Do you have cross?
Yeah, just a little bit. Thank you. Hello, Dr. Rutherford. Thank you for your testimony. I wanted to ask you a little bit. You had said, I think you said that you had originally thought that the shutdowns made sense, but as we didn't get in Kentucky, the overwhelming hospitals in April and May, that you changed your mind. Is that correct?
Well, they kept changing the endpoint. Originally, the endpoint was, trying not to overwhelm the hospital systems, and they kept changing the endpoint, to we have to reduce cases. So I took issue with that because I knew already that it was going to lead to devastating consequences. I had a patient whose son died. He was supposed to appear to court for a drug-related offense, and he overdosed. So it was really clear, I think, just because of what I do and the population that I work with, it was very clear that there were going to be other public health consequences.
I understand. When did you change your mind about the closures?
Probably the end of April. That was when I became involved in a job creators network. They started a campaign called Flatten the Fear. So Job Creators Network is, I don't know if you're familiar, but it's a nonprofit for that is in DC and helps advocate for small business owners. And they contacted me, and I became involved with them, just trying to get information out that how people could protect themselves, how we could protect the vulnerable without all of these secondary consequences.
Okay, so you said sometime around the end of April you changed your mind.
I think.
So, and I mean, I'm going to show you. Well, I'll say in August of 2020, you wrote an op-ed piece that was carried in the Courier Journal, right?
Yes.
Okay. And in that, you cited Dr. Fauci as a resource and said you called him the nation's top doctor. Is that right?
I don't remember what it said.
Okay, I can read that for you. You said, the U.S. Centers for Disease Control and Prevention, the National Academy of Sciences, and the American Academy of Pediatrics support resuming classroom learning, noting the disproportionate impact that the status quo has on low-income and minority populations. Dr. Anthony Fauci, the nation's top doctor, says that reopening should be school districts' default position.
Should be what? I'm sorry, can you repeat that last
Oh,
part?
sorry, that says that reopening should be the school district's default position. Does that sound familiar?
Right. I think he was elevated to top doctor. I think we can all agree on that.
Sure. My point is you cited him as a source, as a reliable source at that time.
I don't think I called him reliable in that op-ed, and I don't know that I would have called him reliable at that point or trustworthy, but I did say that in the that he is considered the top doctor for sure.
Okay, so why did you bring him up if you didn't think that he was trustworthy?
I brought him up because everybody seems to think that he is the authority.
So you were prepared to direct people to untrustworthy sources?
I was making the point that many experts agree that children were safe to be in school.
Okay. Well, in October 2020, Dr. Fauci was quoted as saying, and I don't know if you recall this, he said, we have a baseline of infections that now varies between 40 and 50,000 per day. That's a bad place to be when you're going into cooler weather of the fall and the colder weather of the winter. We're in a bad place now. We've got to turn around. Does that sound familiar to you?
Vaguely.
Okay. He said, if we do 5 fundamental things: universal wearing of masks, maintaining physical distance, avoiding congregating settings or crowds, doing things more outdoors as opposed to indoors, and washing our hands frequently, those simple things can certainly turn around the spikes that we see and can prevent new spikes from occurring. Do you disagree with that?
Yes, I disagree with that blanket statement. I think it's too broad brush. I think there are areas of the country where, you know, they're more rural or might not have been affected by that many cases. So I think it was an oversimplification.
But in a city, that's probably a good idea.
I agree that it doesn't make sense if you're sick to go to a concert or to go to a restaurant. But in terms of mandating that people can't be in a restaurant, I disagree with that. We know that asymptomatic spread is not a big factor with this virus.
I don't have anything further.
Okay, Mr. Reese, do you have any redirect?
I do not.
All right. Dr. Rutherford, thank you so much for being here. I really appreciate your time.
Thank you for letting me participate. Have a great weekend.
Thank you. All right. And Mr. Reese, that is your case in chief.
It is, except that I'd like to, as Mr. Newton did for his tenured expert, I'd like to submit Dr. Rutherford's CV as well. I will email all parties with that. I would move to admit it.
That's fine. I'm definitely going to address all of the expert witness submissions at this point, as far as how that'll be handled post-hearing, or how I would like it to be handled post-hearing. If there's no other witnesses, then I guess I'll go to Mr. Newton to see if they plan on putting any rebuttal proof.
No, I don't believe so. And I would object. I have the same objection to the entry of the CV as Mr. Weiss does. But if, essentially if ours is admitted, then I have no issue with his being admitted.
Well, I usually operate with what's good for the goose is good for the gander. So if I try to be consistent, I
appreciate that.
The ruling should be similar. Since that is the completion of the evidentiary portion, we can move on to discussion of the post-hearing. As I think both are well aware of, instead of a closing argument, there's usually the submission of post-hearing filings. It can range from a brief to submitted findings of facts and conclusion of law. Given what I have heard so far, I think that there's a potential need for a reply schedule, so that if people are submitting post-hearing filings afterwards, then both parties shall have the opportunity to reply to what the other one has filed, especially if there's additional motions. As we get into expert witness qualifications, I could see the need for that. Is there any disagreement or anything anyone would like to add? No? Okay. So how long, today is May 21st, how long, I know there's a couple of other things. I know Mr. Weiss is sort of waiting on hearings that are adjacent to this. I think those are being held in June, is that correct?
The Supreme Court argument, I believe, is June 10th.
June 10th, okay.
I don't know the timing. No one can predict the timing of when the Supreme Court will rule, but
Right.
But I know that that's going on the 10th. I guess just from a logistics standpoint, I don't know that we need to tie it to that. I'm curious from the court reporter. I mean, we're looking at a standard 10-day turnaround because I really want the transcript, and I'm guessing maybe Mr. Newton might too, before we go and we file a brief, because I want to rely on the transcript for that.
Well, the video recording, I'm making available because it's through my state Zoom account. I'll make it available to everyone as soon as it's emailed to me, which will probably be sometime over this weekend. So you should have that by Monday. Ms. Domenico's transcript, I will not rely on whatever transcript comes with the Zoom. That one's not really great, but Ms. Domenico, how many days do you think that an official transcript would be ready?
Do you want to go? You want this on the record or off the record?
I mean, we can go off record.
Okay, stand by. I'm going to go off the record then. The time is 2:30 p.m. Stand by just a second. Well, I am really slammed. So usually these type of hearings takes me like about 3 weeks. So if you need it sooner, I can try to push it up a little bit, but it usually generally takes me about 3 weeks for this type of work, especially since we're going on about over 200 pages at the moment.
Okay.
Is there a date you want me to work against that I can maybe try to have it to you?
Well, let's just look at right now, 3 weeks from today is the 11th. If we're generous because you are busy, that would make the 18th, which is pretty standard, I think, for most hearings, is for 3 to 4 weeks for the transcript to be produced. If it's submitted by the 18th, then parties could have, I mean, I have gone as far as 30 days for that from the date the official record's available, which would put that 1, 2, 3, roughly 4 weeks from that is the 23rd of July.
I can accommodate that. And then what do you want to do?
I do want to allow, if parties feel the need to have a reply brief, why don't I do this? I'm going to try to be as fair as I can. Why don't I be given notice by the 30th if parties think it's necessary? I mean, it may not be necessary.
I think with us getting into experts, I do think it would be helpful,
Okay.
Our reply.
Well, then replies are usually a shorter timeline. So if it's by August 6th, is that enough time for everybody to have time to review?
So I'm out the week of the 2nd to 6th on a family deal. If I could have the 13th, that would be awesome.
Any objection, Mr. Newton, to that?
I'm okay with that.
All right.
So to be clear, that is for the replies as the 13th, and the 23rd is for the briefing, initial briefing.
Yes.
Okay.
Because and that's working off the estimate of June 18th is the deadline for the transcript. Now, if for whatever reason that becomes shifted, as we understand things can happen, I'm sure Ms. Domenico will let everybody know, and I can adjust the timelines accordingly.
Yeah, that won't be a problem. Would you all want PDFs for a copy of the transcript for the attorneys?
Yes, please.
PDF's fine. E-Tran is better if you can do it.
I can do E-Tran, yeah, if you want E-Tran.
Yes, so I anticipate somewhat of a motion practice or attached. I don't know how to quite phrase this motion practice related to experts. I just ask that both parties be as specific as possible. I mean, I think we can all agree that this is a pretty unique circumstance for everyone as far as like what anyone has ever dealt with in their practice. So I just ask that everyone be as specific as possible. If there's motions related to related but external filings, then please be very clear as to how it connects to this administrative hearing. And what I would ask, and this is more, I guess, specific to the department, in the notice of violations, there are 5 listed. If there could be just a little bit of specificity as far as like 1, 2, 3, 4, 5 to whatever facts you're attaching to each one, I would greatly appreciate that. I believe that's all the notes I had kind of jotted down throughout this process. Is there anything else that I need to address before we sign off?
I just want to be clear. We are raising every issue in one brief and then responding in one reply, right? Everything. Okay.
Yeah.
Just clarity. So I appreciate it.
And is this essentially continuing the hearing through kind of post-hearing briefing, and the sort of closing statement would be part of that, or are we doing closing statement? Okay.
No, there would not be any kind of recorded closing statement. So I guess it would just be a written statement as a part of your brief.
Okay.
Of summarizing the evidence altogether, along with any arguments that you want to include.
Did you want us to submit proposed findings of fact and conclusions of law or not? I'm happy to do it if it's helpful. I'm happy to not do it if it's not.
With full briefs, I don't think that's necessary. I usually do it either or in that case, but since briefs are being filed, I think that's plenty for you guys to do. All right. Thank you both. Everyone's been very professional today. I appreciate that greatly.
I have a thing.
I'm sorry. Yes, Ms.
I'm sorry. Yeah, I noticed on the certificate of service of the notice for this hearing, the addresses of the attorneys and everybody aren't included. In the electronic world these days, it seems like everything's done through email. I'm normally put on the transcript the attorney's address, law office, and everything. I don't have that information. If you guys want to give it to me now, or if you just want me to put your name with the email, is fine with me too.
No, I'll send it to you by email. Can you give me your email? Because that might be the easiest way to do this.
Yeah, that would.
I think,
I'm sorry, go ahead.
Oh, I was just saying, I sent one out yesterday just with the Zoom thing. Ms. Domenico was on there. So if you want to reply all to that, I think that should cover it.
Okay.
Yeah, that would work.
Okay.
All right, thanks, everyone. Oh, and I'm sorry again. Will you be sending me a copy of the exhibits, please, when they're ready?
Yes, I will. I will send it in an email that CCs everybody so that everyone can kind of cross-reference, like whether, because a lot of it's sort of at this point tentative numbering. So I'm mostly just going by the order in which it was introduced.
Yeah, and I'd like to compare it with the transcript, make sure it's all.
That's fair. That's probably going to be necessary. All right. Yeah. All right. Thank you, everybody.
Thank you.
All right. Bye.
Bye.